as we navigate the transformative approaches that promise not only accurate diagnosis, but also a holistic, patient centric healthcare paradigm. Let me introduce you all to our next topic: patient centered excellence, transformative approaches in diagnostic services. Now, I'd like to invite our speakers for the panel on stage. Mr. Rupesh Dagar, Chief Business Officer, Krishna Diagnostics Limited. Mr. Sankalp Gupta, Director, B. Lal Clinical Laboratory. Mr. Gaurav Srivastava, Co-founder at Haystack Analytics. Dr. Barnali Das, Lead Consultant, Biochemistry, Immunology and Toxicology, Kokilaben Dhirubhai Ambani Hospital and Medical Research Institute. Mr. Partha Dey, Founder and CEO, U4AT Technologies. Welcome everyone. Mr. Partha will be leading this panel discussion as the session moderator. Over to you, Mr. Partha.
Good afternoon. So we must do something in the post-lunch sessions before we start the session. That's very important, so we get attention for next half an hour. So we are discussing what is that will keep everybody awake. I think the topic itself is a very important factor. And I'm very honored to moderate a panel of, I call it a power park panel, so that we all can discuss about a very important aspects of the putting the patient into the center and how we ensure that we are treating the patient as a customer. There are a lot of transformative approach we keep doing. I think this is an opportunity for us to exchange our thoughts more on that. I will request, before we start the sessions, everyone to introduce themselves, talk about a little bit of the work, what they are doing, and what kind of transformations they are bringing. Then I'll come to the next sets of questions. Rupesh, why not to start with you?
Thank you, Dada. I think, Dada, we have a very challenging task post-lunch. After such a delicious food, I know, it's very difficult for us to keep everybody awake. I'm sure we'll do a good job. So before I introduce myself, I would like to, thank Pinky. I want to thank Dr. Naveen and, Khushbu for organizing this, because this looked like a reunion for us. I mean, I've been working in this industry from last 25 years now. I have worked with 4 leading diagnostic lab, and they all are part of this event. And when I see, people sitting here in front of me, when I meet Dr. Sanjay Arora, it gives a different feeling to us, And so I really thank the organizer of Voice of Healthcare. So my journey is, I started with SRL. I worked there for almost 15 years, which is now Agilus. I worked with Suburban Diagnostic. I worked with Sterling Accuracy. And now I'm currently working as a Chief Business Officer with Krishna Diagnostic. Thank you.
Hello, good afternoon, everyone. First of all, thank you so much for inviting me as a part of this panel. I genuinely feel privileged and honored to be a part of this eminent pool of panelists. In terms of, who I am, so it's been now 8 years since I've joined in the business. I'm a second generation entrepreneur. And telling more about what Dr. Bilal Lab is, we're a lab which started in Jaipur in the year 1991, and it's been now 33 years. We've completed 33 years of our inception, and we now are present in 12 labs, 12 cities, and now have more than 140 collection centers. So looking forward to a great interaction. Thank you.
Hi, Gaurav this side. First of all, thank you, VOH, for bringing this amazing forum together. It is a privilege to sit in front of the illuminaries of the healthcare industry and share my thoughts and listen to everything that they had to say. It's a learning experience for me as an entrepreneur in the healthcare domain. As a person, I'm an engineer by education. Actually, I'm an engineer in the healthcare domain. So that itself is a place where it requires a significant amount of learning to come in my way. And these are forums which are helping me in my journey. Uh, Otherwise, Haystack is my third company. We are, as a company, focused on bringing genomics to diagnostic labs. We believe genomics, molecular technology, and genome sequencing is going to be the future of healthcare in a very, very big way. And we envision a world 5 years from now where practically every diagnostic lab who is running RT-PCR today would be doing genome sequencing on their table. We build that technology which will enable you. Currently, our focus has been on infectious. We have built technologies for tuberculosis diagnostics using whole genome sequencing, where we provide 18 drug susceptibility, and now a product for infection screening, where we do pan bacterial, pan fungal infection screenings using a single test. It's our own proprietary technology that we have created. We think it's a technology which we have created in India for the world. That's our ambition. Look forward to the conversation today. Thank you.
Thank you. I'm Dr. Barnali Das, and thank you, VOH, for giving me this opportunity with this esteemed panel and esteemed people around. And I am lead consultant of laboratory medicine in Kokilabend Dhirubhai Ambani Hospital and Medical Research Institute. Along with that, I'm chair of Association of Diagnostic and Laboratory Medicine, ADLM, previously known as Association of American Association of Clinical Chemistry, AACC, and I am in the Executive Committee of Scientific Division of IFCC and different other committees of IFCC. Along with that, I am in different expert panels of ICMR, for example, establishing reference interval in Indian population and different other panels. Thank you. Thank you for giving me this opportunity.
Thank you, panelist. My name is Partho De. What I do is run a startup out of Gurgaon. We try to focus on doing work at point of care. Could be at home, could be at office, could be at any other locations, remote places, villages, beyond pathology. So while we are discussing majorly on pathology, I want to also bring the focus of diagnostics towards the non-pathology segment as well. We do X-ray, ECG, pulmonary function test, Holter monitoring, around 7 tests at home, all of clinical quality, and we do provide report within 1 hour. That's a TAT that we promise and maintain. We are able to maintain around 98% time the TAT for the work we're doing for the patients. Patient centricity, if we keep the patient into the center, then definitely all our problems are solved. And I'm sure all of us are doing that, right? This is not a new subject. So when this subject and topic comes for discussion, I always feel that we always do it. Without the patients, we don't exist. But now the question is how we are considering the patients as a customer, as a consumer who is demanding a certain level of services, and how we are going to meet his expectations. So there are two parts of the story. One part is the diagnostic quality of the clinical excellence to ensure that there is a diagnosis that we're doing. Based on that, the treatment outcome will be better. So that's a story which is a more a clinical part of the story. At the same time, we want to add that what we are doing in the customer servicing aspect of the patients. Patients over here is expecting what they get from any retail. They said that if I'm paying and getting my services from any other service provider, why don't I get same or more where I'm visiting a lab? So that's the expectation, and that's the right expectations. And our discussion should be focusing today mostly to see that what we are going to do for the patients, what kind of transformations that we are running internally in the organizations, what we plan to do, and what kind of a technology that we'll be using to make a patient a satisfied customer. So I would like to start with Dr. Bonali, being the lady on the panel. I think you have the privilege to pick up the first question. Why don't you tell us from your experience, and you are a clinician, so you probably can relate it a little more. I'm sure Rupesh will give a lot of stories from the marketing perspective. So many years he has worked. So if you can just highlight more about the automation, integrations, particularly digitizations, what you are doing to ensure that you have a satisfied customer.
Thank you. So, being a lab physician, I believe in the philosophical lines of Albert Einstein. Life is like riding bicycle. To have the balance, we should have the balance to keep it going. So similarly, I believe in our lab life, being a lab physician, or like here we have heterogeneous population, if we see that as a heterogeneous group. So I believe this life or this bicycle ride is our ride in our lab, or either it's a professional ride or personal ride. So there are two wheels of this bicycle. One wheel is the wheel of patient centricity, where we depends mainly on quality, like accuracy, precision, then cutoff, reference interval, or when we talk about omics, different omics. So this is called personalized medicine or precision medicine. So this is the patient centricity. Another wheel is the wheel of cost. So we can't ignore the wheel of cost. Wheel of cost depends on three magic M's: man, machine, and materials. So when we talk about this panel, we will see, I think this covers the all three magic M's: man, machine, and materials. So if we can balance between these two wheels, one is the wheel of quality or patient centricity towards quality patient care or patient safety, and second wheel is the wheel of cost. So I think we can have smooth ride in our lab life or in our healthcare journey. So for example, let me give one example. So during COVID time, COVID pandemic just started, I think February 2020 around. So I was making pancake on Sunday morning for my child. And then I got a call from our intensivist at around 7 a.m. in the morning that Barnali, we want to give one patient who is a clinician in another hospital, big hospital. He came to our hospital and we want to give the tocilizumab, IL-6 receptor blockage. So we want to give the patient tocilizumab, and for that we want to do the test named interleukin 6. And this is February 2018. Okay, I said, we are not doing the test. Let me find out in Mumbai who are doing the test. So then I called, I circulated in different WhatsApp group and I called everyone. So in Mumbai, nobody was doing the test. One lab was doing that on Thursday. But I have to save the patient, I have to release the report on Sunday morning. So then I asked, what can I do? Nobody is doing, even in whole India, nobody was doing that time the test, because the workload was very less and people never thought that it will be a good test. We also started sometimes back, but we stopped because there was no workload. But that time they wanted to give tocilizumab interleukin 6 report. So then even immediately I got call from my infectious disease specialist that they want the report in 1 hour time, because they have to administer tocilizumab because the patient is deteriorating and cytokine storm and everything. So even oxygen saturation, so patient is going on ventilator support. So then I called our IBD manufacturers and I asked, can you supply me the kit? So they said, okay, madam, that time lockdown. So no technical support, nothing. So they opened the, their warehouse and supplied me the kit in 1 hour. And then what about our validation team, our validation procedure, because we have to maintain the quality, patient centricity as it is important. Same thing is important, patient quality, patient safety. I can't based on the clinician request, I can't say, okay, in half an hour time, I'm releasing the report. I have to validate the new test. So then I called College of American Pathologists, being in their different committees. And I that time I was in CLSI committee for validation. And so I called CLSI and CAP and IFCC. Then in pandemic situation, I have to release the report in a 1 hour time. Well, how to do the pandemic validation? So then they suggested to do reproducibility and release the report. So our team arrived in lockdown. We sent for transport. So see, this is the beauty of, if you say, the laboratory journey or diagnostician's journey or clinician's journey. So here, see the stakeholders. Our main point here is patient centricity, patients we want to serve, and see the stakeholders, diagnosticians, stakeholders, technical staff, stakeholders. Our business administration is the stakeholder because they have to give me permission to start the test in half an hour time. Then IVD played significant role as a stakeholder. Then accreditation body, because CAP and NABL, you know, that time how NABL, even Leh Ladakh, we on by digitization, we supported to open the lab. So this is the beauty of the patient centricity.
Thank you so much for sharing your own personal experience of how you put the patient in the center and get everything worked out, right? Quality has to be maintained, but you found a way to ensure that you are giving a quality report within the defined time. Some point of time, we have to do a balancing act between the two, and you have acted it really nicely over here. Thank you so much for sharing that. Rupesh, if I can come to you and let's have some business discussions. So, as a chief business officer, if you can tell us how big the business that you are managing. We keep hearing about numbers. The numbers are really mind-boggling. So I think today the time has come to kind of unlock some of these. And also, I'd be very interested to know how you guys are still able to kind of manage the quality and customer centricity in a public facility. You know, we all talk about that, doing that in majority of the private facilities, the kind of people who are visiting us. Comparatively, the kind of people that you guys are managing, I understand that they would have majority of the cases, the profile of the people are a little different than typically we see them in majority of the private hospitals. And you have some private patients as well. What is that you are doing to bringing the balance of the doing a huge amount of cases and also ensuring the customer centricity?
How much time I have to answer? 3 minutes. The clock is clicking, so I thought. Well, I'll try to answer in within 3 minutes. Yeah. So I think first and foremost, we at Krishna, we understand the geographical diversity. Our effort, actually enhance, right from the urban areas to the heart of the communities where we provide diagnostic services. Strategically located facility is one of the key reason why we are able to do it. This actually, reduces the distance hinder which any citizen of wherever they are part of the country they face. Whereas affordability is concerned, I'll not say affordability, I'll say value of money. This is actually a cornerstone in our mission. Our strategy is such, we always focus on this concern. Our pricing models will always have a fairness in the mind to keep price which is more easily, people can afford. Because the kind of crowd customer we are addressing. We have also invested a lot in technology, which can bring down the cost. Apart from geography, if you see the cultural diversity or the language barrier, what we do is we operate in 18 states currently. Wherever we go, we hire the local staff. Like for example, we have operation in Himachal, Odisha, Assam. The people who are working with us are the local employees. The one thing by doing that, what we achieve is we take care of the cultural, the respect and understanding and the language barrier. So that really helped us to, get that staff in it. The most important thing, I mean, what you mentioned is about the volume. If I give you the number, in last 5 years, we have touched around 40 million lives. We have done 21, we are doing actually 21 million tests per annum. 15 million plus pathology tests we do per annum. And if I say MRI, CT scan, we do around 5,000 scans a day. 15 to 18,000 X-rays a day. That's a huge volume what we handle. So when we have this kind of volume, it helps to give you the bargaining, sorry. It helps to give you the bargaining power. So we get the best of the vendor on the board. Like we have Abbott from America. We worked with Horiba from Japan. diocese from German. But we also believe in Atmanirbhar Bharat. So we also worked with new startup. Stick2Pill is one where we are working with that. I mean, that's how we we leverage the benefits. So if I see the healthcare diagnostic, I mean, if you see the history, this patient-centered approach started late from 1960s. There were two things which the healthcare industry focused on. One is definitely on the evidence-based practice, and second is the patient-centered, excellence. What we are trying to achieve. Every company, many of the company have this patient-centered excellence as a part of their mission, vision, or values. So do we also have. But sometimes it's difficult to achieve that, Anama, because simply, it's easy to, say, okay, we will go and give the best of patient-centered excellence. Uh, the challenges are different. In urban areas, we have a Dr. Google. Now, Dr. Google is one where any patient who walks into a center, he is equipped with so much of information. The expectation of that patient is different level in urban areas. But in rural, the challenge are different. Uh, as I said, we are present in government infrastructures, in CHCs, PSCs, medical colleges. So our entire infrastructure is in government setup, where a patient don't have to travel 30 to 40 kilometer, for a scan to be done. He can just go to the nearest, subdivisional hospitals, get the scan done. It is reported through teleradiology hub, what we have in Pune. Uh, just to share with you, our teleradiology hub is India's first NABH aggregated center. That speaks about the quality. We have 300 radiologists working around the clock. So we maintain a TAT of 6 hours for reporting scan. If it is, there are time when there's a critical reports, we do report within 2 hours. So that is the area where we really feel we have we have achieved accessibility and affordability, both the thing. Uh, if I have to really sum up, what I want to communicate is, we are really committed to this accessibility and affordability in the diagnostic services. This is actually ingrained in our mission, and we really believe, okay, the healthcare facility is, it's a fundamental rights. It is not a privilege. So we really want to work in that direction. We are dedicated to break down the barriers, because that's how we will make patient-centered excellence a reality in this country. Thank you.
Absolutely. Thank you so much. So the kind of scale that you guys are managing is awesome, right? And I really picked up the word that you use, that affordability and the value for money. I have money does not mean that I need to spend. So some point of time we mistakenly think about a consumer behavior. But the consumer always look for value for money, and that's the key for any customer servicing things that we provide. If we think that we'll provide something which will add cost, consumer may not like it. So that's one important aspect. Just taking the cue from here, Sankalp, you were also running labs, and for quite some time you were the second generations of running the same lab. I'm sure you have plans to take it to a completely different notch. I would like to understand from you that how you guys are ensuring that when you are running multiple of labs in multiple locations, then that similar quality of services, how you are replicating everywhere. If it's comparatively easier if it is being done in one locations, because you yourself probably being present and can manage things over there. But once it is being done in every different places, what is the trick that you play to ensure that same service is available, same experience is being available? We sometimes call about a McDonald's experience. We have the burger everywhere in the world, it is the same. So what is your formula for that?
Right. So first of all, when you take the word excellence, and especially we as healthcare professionals, for us, excellence has to be the starting point and not the end. That is what the expectation of our customers and of our patients are. And, as a business owner, if I would have to say that, to deliver excellence, what do I expect? I think there are two things. First is right intention to deliver excellence, and second is right expertise. So intention and expertise, if that is there, then you're able to actually deliver excellence on ground. By intention, I mean that genuinely do you desire to give that excellence? And when you're scaling an organization, it has to go from the leader. It has to go from the promoter or the leader. There has to be, when we talk about culture of excellence, then you really have to define by your actions that there is a culture of excellence, and consequences in the organization have to be defined accordingly. So that is one important thing, where every person who's associated in the organization, be it a partner, be it an employee, whether they have the right intention. And second is right expertise, where you know uh, from today's session I've picked up a lot of buzzwords which are technology, artificial intelligence, but I personally would keep human intelligence much above than artificial intelligence, because as a diagnostic provider, that is what is expected and required. I picked up from Dr. Sushil Shah's session. He termed one important pillar of service delivery as empathy. And what he meant was empathy. Is it missing in terms of technology, scalability, all of those things? Empathy is missing, and that is what even we as a service provider feel, that genuinely, that human to human connect is missing. In 1991, when we had started, we started with one center, and it was very easy. I'm sure not easy, but I can term it as it was something that you as a promoter is sitting there and able to manage the quality, the excellence, whatever you desire, you're able to do that. But when we had started to scale, we were facing some kind of challenges in terms of delivering similar quality in other areas, in other territories. And primarily, we focused on three areas. One, people; second, process; and third, technology. And all three in chronology, like the order that I had stated. People, I think, for an organization and for a service provider, having right people at right place with the right skills is necessary. When I talk about people, it also has to have be applied on the partner that you're choosing, because now all the chain labs are operating through partners, and I just think that the people aspect is a little underscored, because a lot of focus is on technology, scalability. But when you're selecting a partner, I see that even for the national labs, one partner is selected, after 3 months the partner is being closed. I'm not sure if the selection process or how much attention is being paid to the people associated with you, and the people, do they have that intention to really deliver. In terms of I'd also touched upon expertise. And when I talk about expertise, I mean, just from my experience, we had faced those challenges of people not having those similar kind of skills. When we were onboarding people, we were not able to do that properly. One thing that we did was we created a technology platform called eKurukul, which was a learning management system. We created our own content, right from pre-analytic, analytic, post-analytic, all of those things ensured every employee that is being associated, every partner that is being associated goes through that mandatory sessions. Through assessments, we're able to really check that they are at a basic level of their skills. And, it really turned out to be some kind of a success for us, where we are at least confident that the service on the ground is at least similar to what we aspire to. Uh, Second part, which I talked about, is process, which is again very important and defines how a business should operate, and has to be closely aligned with people. And third being technology, which of course makes these people and process compliant, more efficient, and when we're delivering, it makes it more effective. And then with technology, scalability comes very easily. Just one more example I would want to give is, I'm sure every diagnostic lab faces a lot of pre-analytic errors, and especially demographic errors, basic mistakes that your front office does. What we did was we invented a complete module on our lab information management system, which was called as a way of working, known as WOW module. And every quarter we gave our partners or people some score, and based on the score, whatever mistakes that they were doing, they were automatically triggering on the LIS platform, and they had to justify, what was the reason. If it was not justified, they had a consequence. I mean, there was a reduction in points and all of those things. And based on that, every month, quarter, they had their consequences, be it a reprimand or reward that was associated with that. That really helped us reduce our non-conformities. So, I mean, people, process, technology, all of these things really ensure that we're able to effectively deliver our services as we are doing it in our center of excellence.
Excellent. I think this is basics, but we must follow the basics. Right? The challenge is sometimes we don't follow the basics and we try to do something not surrounding the basics. But if the core is not there, anything surrounding the core will not help. So thank you so much for sharing your experience. So Gaurav, can you demystify this genomics for us? So let me ask a consumer question. Okay, so as a consumer, we always feel that this is something outside the reach of people. Only some super senior doctor can prescribe this kind of test, and these tests are only required for diagnosis of very very high end, something which would not be required for the general consumer. So I don't know whether everybody would agree with me about the perception of a general consumer about genomics, but when I talked to a couple of guys, I found that's the kind of echoing in their thoughts. So why don't you tell us that what actually it means and how we actually can change the consumer perceptions? That's important.
It's a very loaded question. So I think it's a fair understanding that today the world perceives genomics as a very niche technology, and I think one of the key reasons for this perception is also the it is being walled. There have been specific companies who have built capability in this technology, and they have operated this as a niche offering. But I think that's also changing. So we believe there are like again three pillars which will enable as a technology. So for a consumer, technology is irrelevant. Outcome is what matters to the consumer, and for the outcome to reach to the patient, or the consumer, what is important is they are able to afford it, they are able to access it, and they are able to take actionables basis the information that is unlocked to them. What is genomics? Let's take a like 101 on genomics very quickly. It's a two-step process where you first take the DNA, the analyte, you digitize this DNA, and then you go to the next step where you then the data that has been unlocked, you analyze this data and pull up a lot of insights. Genomics has been around us for significant specialties, onco, NIPT, etc., for a long time. Now, what we are seeing is the entire applicability of genomics is increasing significantly because number one, science, the understanding of the science has increased significantly. But more than that, what has happened is the cost of data creation, which is the sequencing process, has come down a lot. There are much better equipments which are available, much cheaper equipments which are available, which can actually sit on the diagnostic labs table and do the data creation. And now there are softwares like what Haystack is creating for specific outcomes, which are reducing the cost of the data analysis and hence bringing out the clinical outcome. Now, why is genomics important for the healthcare ecosystem? I think genomics as a science has the capability of unlocking a fantastic amount of information. Why? Because when you're doing a PCR, you're looking at a fragment of the DNA and you're able to unlock the specific question that was asked. When you're looking at the entire DNA, that's what genomics allows us to do, sequence the entire DNA. You are able to unlock a fantastic amount of information. But then from a patient's point of view, from the doctor's point of view, for that clinical condition point of view, what is important is to understand what is the most relevant actionable information that you are able to present, right? And that's where I think as a company, as a product creator, we spend a phenomenal amount of our time choosing what should be the right platform, what should be the right protocol, and hence what should be the right outcome information that should be brought out to the doctor so that he's able to take the most action, but the right decision in the first go, right? That's the problem to solve. Uh, Now, how have we done it? So, if you think about acute, infectious is where we have operated for the last 2.5 years of our inception. And in acute, a satisfied patient is the one who has been cured. Then, how do you ensure the probability of treatment, the probability of therapy success is the highest by unlocking the most amount of relevant information. Now, when we took tuberculosis for an example, we looked at how tuberculosis treatment is currently happening. At the doctor's table, the decision that he has to make is he has to provide 4 antibiotics to the patient for the entire journey of the therapy, which is possibly 6, 9 months, up to 12 months to 18 months. But the information that he has available is very fragmented. He knows about with one test a single antibiotic whether it will work or not, and then 3 antibiotics whether they work or not, and then 3 more, and then he goes to culture where possibly 13 antibiotics ke bare mein information is available to him. But there are more nuances. What if the patient has a co-infection? Because TB patients show that symptom. What it is if it is a NTM, which can in several times be caught as a tuberculosis in one of the preliminary tests. So we decided then to create a comprehensive solution and use use genomics and then use whole genome sequencing for bringing all of these together in a single report. So now we have a product in the market where once our report has gone to the doctor, he knows everything that is clinically relevant to pick the right combination of antibiotics that has to be given to the patient, which then means, in a way, we have been able to bring personalized therapy for tuberculosis in the limited scope in which we are operating. Now, when we look at infection in general, there are 1,200 plus pathogens. How do you then solve this problem? We have fantastic solutions that are available. Culture has been around. We have been using this technology. We have PCR and now extension of that as multiplex PCR. Several of these technologies are now available. Now, when we started thinking about it, I think the primary question was, can there be a solution where for the patient and for the doctor, the number of iterations that they have to go through, the cascading mechanism of diagnostics that they have to go to, it can be reduced or it can be completely eliminated, right? So that's the primary thought. So the challenge that we left on the team's table was, can we have a universal infectious test? A single test where we will be able to identify everything. I'm not saying that we have already done it, but that's the trajectory in which we are trying to go as a company. And then we realized genomics is the only way it can be achieved again, and hence this is a perfect fit to our capabilities. We then spent the last 3 years, 2.5 years, in building this up, validating it up, and now today we have a product where we are able to screen pan bacterial, pan fungal. So the doctor today does not need to think about ये डेंगू है क्या या इकोलाई है क्या या एसिनोबैक्टर बोमानी है क्या. He does not need to ask for a pathogen screening. He asks what infection it is, and if in the sample the pathogen is present, we are able to screen. And genomics is a very sensitive technology. It's very well understood. We are able to screen and we are able to provide to the clinician exactly what we have found. Along with that, antibiotic resistance profiles are also available, which then means the iteration is taken away and the doctor is able to focus on the therapy rather than the focusing on the journey of diagnosing the infection or the pathogen that the patient might be troubled with, right? So that's how we are looking at the problem, and we have chosen the problem statements that we would go and solve with genomics basis. Is it going to be the perfect fit as a technology for the scope of the problem that we want to solve?
Thank you so much. So it seems the personalized medicine has just come, right? So we all were thinking that when it will come, so it has come. We have to work with organizations like you to find out the usability more. I'm sure the physician community need to be kind of make aware of what is available. Certain point of time, these challenges also we face. There are a lot of things are being done, but maybe that the way it should have been communicated, that communication has not happened, and that's why there is a certain amount of a consumer education along with all the other things that we're doing probably make it more popular into the market. So before we go to the next sets of questions, I thought after post-lunch session, can I have some questions from the audience? Just to ensure the audience are not sleeping. Is there anyone who want to ask anything about customer centricity? How in a diagnostics era the customer centricity is playing in a role? Anything to do with the digitization? Anybody has anything to ask the panelist? So if you are still thinking your questions, okay. So we'll give 7 minutes time. We'll go for the next round, and this time we'll probably all of us would have 1 minute to talk so that we can complete the session on time. I was in Arab Health in last 3 days. The lot of things has come up, and every year in any of the new so-called expo conferences we go, we get to see a lot of new things. So, lot of new technology coming from the startup company and also from the established company that is coming up, and a couple of them are very clearly looking at the patients and making sure the patient is getting a better service. We were all talking about the point of care pathology, we are talking about wearables, etc. The technology is getting matured. It is not matured yet as per my own assessment, but it is getting matured, and hopefully some point of time it will able to at least do a screening level information so that the people are more aware of what is happening with them. So a lot of things are happening on the technology as such. Dr. Das, I thought I will start with you. If you can share any example of any digitization or anything that at your organization that you guys have done, as in which is impacting the customer. One you have shared with us before. Is there anything else that you want to share with us?
Thank you. So the role of digitization, we realized, I think, during post-COVID era and during the COVID era. So like we are now going for the SDG 2030 agenda, that's the sustainable healthcare. So for sustainable healthcare, we want to decrease our carbon footprint everywhere in our healthcare industry, in our diagnostic industry. How to do that? We need to go for paperless, we need to go for digitization. So for some example, we started, like I remember during the COVID time, COVID risk stratification. We realized because of what WhatsApp and other like Google and all those things, we realized during the COVID time, even all the patients who have the mild grade fever, having the battery of tests, battery of antibiotics to a battery of medicines. So that time, along with IIT Bombay, we started KCDH IIT Bombay, we started two projects. I got the grant for two digitization projects. One is on development of electronic health record for acute kidney injury. And second one is the COVID risk stratification. Based on the COVID risk, if we can stratify the test, if we can stratify the medicine. The second one I will little bit, because that's more relevant even current scenario, that's the acute kidney injury, because in the setup like us in Kokilaben hospitals also, because where there is a quaternary, tertiary, more than quaternary care setup, we have seen that around 5 to 20% cases of acute kidney injury, because of the heterogeneous cause of the acute kidney injury, many times it got missed, because what is the relevant, there is no troponins for acute kidney injury, or there is no acute marker, the markers which are need to be established. So for that, that's 0.3 milligram per deciliter rise of creatinine in 48 hours, and also in 1.5 time rise in 7 days. So these are the KDIGO criteria, and these are so minuscule. So even the clinicians, physicians, many times they miss the acute kidney injury. So we thought in electronic health record, by risk stratify, if we can digitize that. So this is one of the, like, acute kidney injury we are trying, because we thought we can nationalize that plan and we can establish that even at the national setup. Second is the, like I mentioned about ICMR, we have started that reference interval, task force for reference interval and decision limit. So there are, like, when we talk about the reference interval, there are two types of reference interval. We can establish by direct method, where we screen thousands of patients and establish the reference, what is the normal range in the population in India, because still we are using the population-based reference interval in American or European reference interval. So this is the direct method which ICMR has started to establish the reference interval. Second is IFCC, we have the global data base based on the indirect method in your hospital LIS or LIS in your lab. We can establish by indirect method the reference interval or cutoff limits. So these are two of our projects, three of our projects where digitization played a very, very significant role, where we have seen the machine learning, deep learning based the clinical decision support or CDS, clinical decision support, play a significant role in our diagnostic ecosystem.
Hey, thank you so much. So nice to know. Particularly, we all will be looking forward for further information coming from you on the kidney part of it. I'm sure once, because most of these project, it requires a huge amount of data to be successful.
Yes,
So,
and when POCT you mentioned, you
correct.
when POCT is a boon for if it is used properly, it is a boon. So like troponin I based POCT devices, if we can CDS or clinical decision support, if we can tag it with the digitization, it can be a boon for the patient.
Absolutely. Looking forward. So, Gaurav, coming back to you, let's pick up the cost element of genomics. So, while you kind of mentioned that, it is an important tool to make sure that there's a personal medicine being practiced by physicians, at what cost?
I think the way the world has been looking at cost of genomics is going to change, and it's already changing. Last 5 years ago, ask this forum the cost of genomics, they will say, हो ही नहीं सकता, 1 लाख रुपया per sample लगेगा. Right? Today we are already talking about exome sequencing happening because data has become cheap. Right? The data creation, the process of data creation has become cheap. So exome sequencing is today available for sub 10,000. I am today sitting here envisaging and possibly taking a bet that exome sequencing will become as costly as RT-PCR is today. And that's the direction of the general healthcare world as a technology. The way we are seeing it evolve, the unlock is going to be at the data analysis level, trying to analyze and being able to make available to the doctor, to the patient at the right time the information that is most relevant. The doctor at any point of time with genomics should not be thinking कि मुझे test कौन सा करवाना है. And for that, I think this year we will be ending this year possibly not just as a company but in the country mostly sitting at 5,000 ballpark of exome sequencing rates that would be evident. And in 3 years time, I think with the number of players who are coming into the market, with the number of platforms that are coming into the market, a data per GB is going to be possibly in like a $0.50 ballpark. That's what we should expect. And a human exome data is ballpark 10 GB of data. So like, do your math.
Okay. So as a consumer, probably some point of time will look forward at a 400 rupees genome sequencing some point of time.
हाँ वो भी हो जाएगा.
That's the RT-PCR का equivalent I am looking at. Right? If the scale has made a lot of things possible, right? That we have seen, right?
Yeah.
So when RT-PCR started, then RT-PCR was where, and today every company makes money at 400 rupees of RT-PCR. It's not that people are losing money, correct? So all of you are running labs.
I think
so
most of the molecular is actually a problem of scale. RT-PCR COVID 4,000 for 400, 300 rupees, right?
Correct.
I think that's the exact journey we have seen. 1 lakh, and now we are sitting at like 5,000-6,000 rupees of exome on data. And not difficult to assume why this will go down further, because as consumptions are increasing, the input cost is decreasing. That's macro.
Yep.
Right? The input cost of these materials are decreasing. As the applicability is increasing, more competition is coming in. In just this year, we have 2 new players, large players of again sequencing companies who have now entered the Indian market, who want to now push their platforms. So I think this is a eventuality. We are living in a fantastic time where possibly we will not only we will see a lot of the concepts of personalized medicine becoming a reality because of again accessibility and affordability. All of this meeting the eye.
Absolutely. I think we look forward for the days, and everybody should be able to have a personalized medicine being prescribed to them. Okay, Sushankal, very quickly. Again, I'm coming back. Though you said that on the rank of people, process, technology, you put technology in the third, right? So, is there anywhere you think that any specific things that goes in your mind you want to bring, where the digitization or technology is going to make a difference in your customer servicing process?
Right. So, I mean, what I meant to say was, people and process have to be ready for technologies.
Absolutely. We all agree
That what I
towards that.
said. And in terms of technology, and I think for a mid sized diagnostic service provider like us, what I feel is technology, accessibility to technology is really not a barrier. I think it has democratized, and for our internal and external stakeholders both, we've had multiple interventions. I mean, for a size of organization like ours, we're using Salesforce, and for a size of organization like maybe which is much larger than ours, is also using the same platform, really shows that the technology has democratized. And yeah, so I mean, in terms of patient delivery, and in terms of where we are having those technology interventions, I think right from the patient when it looks for our laboratory, to the registration, to the entire patient life cycle, to the engagement of the customer, to manage the customer, the marketing aspect of it. I think all of it is really driven by technology, and in our organization also, it's being done through technology only.
Thank you so
Okay.
much. We have 46 seconds, 46, 45. So, Rupesh, 42. You have to share what next. You guys have done a lot of things, but I'm sure there is something in your pocket. So, what is the next that you are planning? And again, I'll put the digitization and the technology in the forefront. Then, what is your plan?
So, Dada, I think this is a question I asked to my chairman when I joined Krishna. What's next? Because I came from a background from a private, I worked with all private labs, right? When I entered into an organization which is the 95% business is from government setup, the same thing I asked him. He said that you have to give me answer. What's next? So I think what next, just to, know what time we have, I think ladies on the dais, I know we have to finish it fast. What next is, I don't know how many of you has entered our infrastructure and seen what kind of services we offer in government setup. When a patient walks into a government setup, a government hospital, and when he walks into Krishna, infrastructure, he take a step back. He feel कि ये कोई private है या ये तो कोई मतलब कहाँ गए ना? I mean, it at level is what the private players are offering. So that is the infrastructure we have created within the government setup. Now, how we can leverage this for everybody? Currently, there's only particular set of population which goes to a government setup. That's a challenge what we have, which we have taken. In last 1 year, we have really taken a lot of steps, because entering into private business doesn't mean you open a lab and you create a sales team and then you start marketing and the business will come. It doesn't work that way. For us, what was important, how we capitalize on our existing infrastructure. So the number of patients who walks into our center is huge. So we thought of, why don't we start getting private business right from those patients who are already our existing customer. So we started working on our private health checkup packages. You won't believe, in last 1 year we have sold more than 1 lakh packages. I mean, a lot of players must not be selling that in private also, and we have done that. So this is the volume of business we are expecting going forward, which will put us in a different level. Second, we have seen the shift from hospital diagnostic centers to a community centers, to a diagnostic center, to a mobile service, and now to a home care. So home care is going to be a future in diagnostic. So we have understood this strategy, and pan India we are creating a home collection hub. So there are few steps, baby steps we are taking. I'm sure because our numbers are there. We are listed company. I don't mind sharing number. 66% is our radiology revenue. 33% is our pathology revenue. But we are really looking forward to change the business going forward. Thank you.
Thank you so much. And yeah, there's a question.
Actually, my question is to Mr. Rupesh. Given your volumes and numbers that you're talking about, how are you capturing your customer delight? Because your customer delight is directly related to your top lines.
Exactly.
In the area of operator, I'm sure you must be the private space along with the government space. How are you capturing your customer delight? Are you using any technology to reveal?
So I did mention this in the beginning. We are leveraging a lot of technologies because we understand bef- we are at the level where our major customer focus is on rural areas, on patients who are already coming to a setup where they're expecting everything is free, right? So we are at that level where what they need is a TAT, they need report on time. What they need is the affordable cost. They get delighted by this only, right? So we are trying to focus and deliver that with the help of a lot of technology. And I mean, we see the technology is changing in the diagnostic. I mean, every lab now have cloud computing, right? But the now the future, which is the blockchain like technology, or maybe the virtual reality, or quantum computing, nanotechnology, a lot of new things is going to come in the industry. We have developing, we have already, he mentioned about the Salesforce. We are already migrating towards a CRM software where we'll try and address delight the customer. So there's a lot of step already taken. I mean, I can't share everything, otherwise I can offline, I can share.
Okay, so guys, thank you so much for this insightful discussions. I think over to you, madam. You can start the proceedings.
Thank you, panelists. Thank you for that insightful information and discussion. I'd like to thank Mr. Partha for wonderfully leading the panel, the discussion. I would now request Mr. Partha to felicitate our panelists, and I would request all panelists to step forward for felicitation. Mr. Rupesh Dagar, Mr. Sankalp Gupta, Mr. Gaurav Srivastava, Dr. Barnali Das, now I'd like to invite Ms. Pinky Cheher to felicitate Mr. Partha. Mr. Partha De. I request everyone to please come together for a group picture. Can we have a huge round of applause, please? Now, moving on to the next discussion. Join us as we unravel the threads of innovation and examine emerging trends that promise to redefine the very fabric of diagnostics. Together, let us navigate the exciting terrain of future proofing diagnostics, where strategic investments and collaborative efforts converge to shape the future of healthcare. Bringing to you our next topic: future proofing diagnostics, investment strategies, collaborations, and emerging trends. Now, I'd like to call upon the stage the speakers for the panel. Dr. Sanjay Arora, partner, Shubhan Ventures, founder, Suburban Diagnostics. Dr. Nilesh Shah, President and Chief of Science and Innovation, Metropolis Healthcare. Mr. Anand K, Managing Director and CEO, Agilis Diagnostics. Mr. Deepak Sahani, Founder and CEO, Healthians. Mr. Rahul Agarwal, Managing Director, Quadria Capital. Mr. Sudhakar Mishra, South Asia Head and Global Senior Director, MedTech, Healthcare and Life Sciences, Frost and Sullivan. Please welcome our panelists with a huge round of applause. Mr. Sudhakar will be leading the discussion. Over to you, Mr. Sudhakar.
Good afternoon, everyone, and thanks a lot for this session and to VOH for facilitating this and organizing for and calling all the panelists. So the session is really very interesting, and we have an interesting panel here because we have close to 150 years of wisdom into the diagnostics lab space. So, and these are coming from a lot of people who have established, grown this business through years. And my name is Sudhakar Mishra. I lead the healthcare practice for Frost and Sullivan. And then I will also ask my panelists to introduce them briefly, and then we can go into the topic, what we have for today. So maybe we can start with you, Sanjay.
Good afternoon. I think 150 years, I think you're making some of us really look old, I guess, on this. So.
Total, aggregate.
So, Dr. Sanjay Arora, pathologist by qualification, founder, ran Suburban Diagnostics for close to 30 years. Currently running Shubhan Ventures, which is a family office focused on the future of healthcare.
Hi, good evening. I'm Dr. Nilesh Shah. I'm a group president at Metropolis Healthcare Limited. Spent 38 years in the industry and 37 at Metropolis. Thank you so much.
Hi, good afternoon, good evening. My name is Anand K. I'm currently the Managing Director and CEO of Agilis Diagnostics. I've been in the industry for the last 30 years. Thank you.
Yeah, hi, this is Deepak Sahani, founder of Healthians, which is a e-diagnostic business. I've been into this space for about 10 years, but in healthcare about 23 years now. Thank you.
Hello, everyone. I'm Rahul Agarwal, Managing Director at Quadria Capital. We are a healthcare-focused private equity investor investing in South and Southeast Asia. So something bit different about us. Only focused on healthcare, started by a doctor and a lifetime healthcare investor and investment banker. Happy to be here. Thank you.
So thanks a lot, panelists. So we know that one of the key aspects right now is we are going through global uncertainties, slowdown throughout the world. And we see this also impacting all the industries. So as we have a couple of investment bankers as part of this, investors, so I would like to understand their perspective on how do they see the current state of investments going, especially in the diagnostic labs industry. And maybe I want to start with Sanjay, and then I also want Rahul, you to comment on that.
So, Sudhakar, my journey is fairly recent, maybe less than a year, where we are looking at the future of healthcare. And in that, honestly, we are not looking at diagnostics because, I've been part of the diagnostic industry for 30 years plus. So at this point of time, our focus is outside diagnostics, and but also complementary to what can be done in diagnostics. So I think the space that we are looking at which is commonly affecting everybody, is wellness. So I think wellness is a trend that sort of picked up during the pandemic, and it's become a buzzword for everybody. So looking at what can be done towards what we call as digital biomarkers to improve wellness outcomes. I think oncology is another space, especially when we heard the previous panel speaking about NGS being democratized. So how do you bring better outcomes in oncology? I think these are some of the areas that we are focused on, and we're looking at trying to provide what I call is patient capital. So, today, most of the capital that is invested is time bound, in the sense that within 5-7 years, uh, there's an expectation on return on investment, which sometimes does not allow for innovation to actually seed. So I think here we are trying to also look at what is the future of healthcare, and can we be part of providing patient capital which will allow for innovation and R&D to actually develop within India. We see a lot of that happening overseas, where perhaps the incubation time is a little longer. So IP related investments is something which we are trying to evaluate and see.
Right. Thanks a lot, Dr. Sanjay. And quickly, Rahul, if you would like to come in, because you have been into this business, and I know that you guys already have into brick and mortar business, and slowly you're evolving. So any commentary around that, or how do you see this journey evolving as the technology evolves and companies are becoming more and more technology focused?
Sure. So the future of healthcare is bright, very bright. We are healthcare investors, so no other option but to say that. But genuinely, in South and Southeast Asia, and I think everyone here is somehow connected to healthcare, you don't need to prove to this audience why the future of healthcare is very bright. If you see from an investor's perspective, I think healthcare in India has been amongst the top 2 or 3 sectors consistently over the past 10 to 15 years in terms of private equity and venture capital investments. And I think that is likely to continue. Great success stories. I think 4 gentlemen sitting here have created some of those, 4 of those great success stories. We have 2 arms, right? Quadria is a growth capital focused investor. So we look at mature businesses where the business model is proven, has already scaled up, and businesses need capital to grow further. We also have a VC arm, right? Something similar to what Sanjay is doing in, maybe a bit of different shape and form. It's a fund called Health Quad. They are investing in early stage healthcare businesses, a mix of health tech and other models which are supporting, let's say, the brick and mortar businesses, right? I think in both areas we see significant opportunities, significant traction, and a never-ending need for capital. A very good supply of very smart, very energetic, and full of idea entrepreneurs. Good businesses getting built. Quadria, we would get focused on a bit more established stories. Health Quad would look at the earlier stage side of it. I think Sanjay made a good point that, and I would sort of maybe add to it that you have to look at different pools of capital, right? And a pool of capital has to meet the need of the company, right? So 5 to 7 years, which is our perspective, works a bit better in established companies where the business model, the risk of proving the business model, the unit economics are all proven. But thankfully and fortunately, and some of the people are there in this room, there are alternative pools of capital emerging, right? So family offices, for example, Sanjay, right, who can take slightly longer, slightly bolder bets. You have now corporates, healthcare, pharma corporates who are now venturing out and supporting ventures in affiliated healthcare areas, right? So they hopefully represent more patient pools of capital who can take those bolder bets and maybe stay in companies for 8-10 years and look at it from a more strategic perspective, right? And bring some more value add to those investments. PE funds, again, PE and VC funds, you'll see generalist PE, VC funds who will be a bit impatient in the time frames. Someone like us, a healthcare fund, we understand that healthcare, you can't change healthcare overnight, right? It's a slow process. It takes its own time. And I think, some of the questions which will follow, I think probably we'll discuss that, some new age ideas, how soon can they see traction? So I think two big points. Number one, I think the future is obviously very bright, but you should look at various pools of capital and try to match a pool of capital to the need of the business, because that's when the best partnership would happen.
Right. Thanks a lot, Rahul, for bringing that perspective. Definitely, we need to look the beyond and from the current state. And now coming on that, because we still see a big unorganized sector. And Anand, I know that Agilus has played, and also all the other gentlemen here have played a significant role in organizing this sector. But still, we see that the sector has like roughly 15% representation of organized versus 85% unorganized. So how do you see this evolution happening in coming years, and what's the trend, and how do you see this industry really shaping up for more and more collaborations going further and trying, because what we see also in US and some other markets, that the bigger players are even becoming bigger, and the industry is far more organized. So Anand, your thoughts on that and perspectives around that?
Thanks, Sudhakar. So this organized is a very loaded word. So when I talk to many laboratories, they get upset or offended sometimes when you use the word unorganized for them. So it's basically some classification among the investors community which has led to this, where you have an organized and unorganized being classified like that. So it simply means that these are large chains which have some private equity investments, or they're listed. So those kind of groups. So now even we have further classified it into regional organized chains and national organized chains and all that. So, but be that as it may, we are quite clear that yes, we still have a large pool of what is called as unorganized across the country, and that gives an opportunity to consolidate both for the regional players as well as for the national players. And I'm sure the future trends in healthcare, like the coming in of insurance, the requirements of accreditations, the requirements of Ayushman Bharat and such activities, these will bring about more and more labs getting together, collaborating with each other, as well as finding opportunities to work together and partner, both in contractual as well as strategic ways.
Thanks a lot, Anand, and thanks for clarifying around organized and unorganized sector. So, Sanjay, you want to make a remark? Please
if I
go
can
ahead.
just continue on what Anand just said, that I think one way to also differentiate is, if there are 3 lakh laboratories in our country, we don't have a registry actually to truly tell us how many labs are there. How many are enable accredited is perhaps one way to distinguish. So maybe less than 3,000 labs are enable accredited versus majority of them are not. I think that perhaps is one way to maybe segment the market. But I think there is a need for consolidation, but there's also a need for dissemination of services in areas to provide better access. So I think it will be a constant evolution where you will have the spread towards the hinterland, but also maybe consolidation happening as the market moves up the pyramid. So I think it'll be a constant evolution. But I think if there is a national registry that can be created, if we can actually know how many labs exist, if we can actually facilitate more and more labs to adopt accreditation, I think the opportunity is overall to lift the standard of diagnostic care. I think that's where I think we should be trying to look at.
Hey, thanks a lot, Dr. Sanjay, for that perspective. And you are absolutely right. There is no single source of truth for a lot of data, because it's not really accounted. And maybe as per our estimates, also it's almost 1.1 lakhs labs, out of which around close to 3,000 are NABL accredited. So coming to Dr. Shah, so you have been leading a lot of scientific innovations, and how do you see that also playing a role as the company emerges, and what role it has to play in making it better for patient outcomes as well as return for investments for the company itself?
So our industry, somewhere we are on a probably little commercial platform, but without science, commerce will not work. So staying in touch with science and scientifically growing is inevitable. There have been few companies I do not want to name. They tried all tricks to get bigger only on commercial front, and they fall flat. So growing on science, so new product, new technology, improving your cost, efficiency, and quality is a consistent journey, keeping patient first and ensuring that doctors are enough helped is something, a path which is inevitable if you want to sustain for decades from now. If you want to be a short-term player, then you can avoid it, otherwise not. And your investments also have to be aligned to that. So you look at ROI, we use the word ROI, and I'm going to take that. The ROI cannot be looked only at commercially. ROI need to be looked in terms of efficiency in reporting, quality enhancement, and also cost. All three balance has to be there. Then it is a right investment, I would feel. Yeah.
Thanks a lot, Dr. Shah. And coming to Deepak, we have seen a significant growth, how Healthians has grown, and any observations on these aspects from your perspective, looking at how the industry is moving in next few years, and what are your thoughts around that?
Sure. No, I think summed up very well. So one, obviously, we also see there is, when we talked about an unorganized sector specifically, I think it is becoming organized. There was a wave during COVID wherein there was a need, or there was an ask for a brand. Otherwise, in diagnostic, brand had no value, right? There were a lot of brands. During COVID, we saw there is something called a brand that has started coming up, which is moving towards organized. But there are a lot of good labs out there, and I think there is a future of collaborations, like we see consolidation, collaborations, because building lab everywhere does not make sense. It's an infrastructure lying empty everywhere, and I think the collaboration in that direction will work really, really well. Coming to the point, I think there is definitely a lot of investments that has to go into technology, because that's where, like Mr. Shah said, I think it is also about clinical technology as well as the IT technology. Both go hand in hand, and that will probably improve the overall outcomes. In the last panel, we were talking about a lot of things in technology, and there were different views in terms of why technology is needed and why it is not needed. Where we come in from, the whole growth of the business has been based on technology. With obviously a fleet of 2,800 people in the front end, managed by only 9 people at the back end, was only possible through technology, and it was not possible other way around. So technology in many ways has helped to probably optimize the cost, stay at a good gross margin levels even at discounted prices. And I think it is there to stay, because a lot of evolution will come in that particular space. Today, we handle a lot of big data through AI and technology, which helps us to probably give better outcomes or recommend tests, or probably also recommend tests after the sample is being taken. So all that is possible over technology. And there are a lot of such use cases, which has actually changed the whole angle of, you can say, convenience, whole angle of the customer centricity, whole angle of uh, getting better and better services at the consumer end by using technology. So I think that's something that most of us will have to continuously invest, and innovations will happen there.
Great. Thanks a lot, Deepak, for those insights. And I would like to also build upon the point which we have been delving more on, how do we see next 10 years progressing, especially from the investment community. So I know, Rahul, you touched upon briefly, but that the healthcare has huge scope, that's undeniable. But what kind of investments do you see picking up more and more? Is it moving for more IP-led, as Sanjay was talking, and you guys want to take a bigger risk into the whole game, or the players like, because I'm sure technology is going to be game changer, right? So if you look at AI or data or machine learning, whatever roles they are playing, so maybe the investment firms need to be also be a little more bold in investments. So any thoughts around that? What's going on within the community, investor community there?
Yeah, so see, India is a very large market, right? And still a lot of unmet need. So a lot of investment is required to fulfill the need gap. And India is a very interesting and unique market, which is both fulfilling its unmet needs, but there is enough skill, talent, capital, and risk-taking capability available. That's unique. Unique in India. There may be few other markets as well, where apart from trying to get basic healthcare to who don't currently have it, so increase that access, the country and its healthcare system is also advancing very fast, and both investing, creating operating capabilities, and adopting newer ideas while trying to take. So on one hand, you're taking basic healthcare to those who don't have it, and then trying to, elevate, move up the value chain on every aspect, right? So now linking to where investment will go everywhere, right? Investors chase a return on capital, right? While, I'm sure there are more clinicians, operators in this room, and they will say, hey, investors, you only chase return. But see, ultimately, businesses have to be sustainable, right? And that's how investors will always evaluate. And that is the investor's value add to a business, right? How do you build a business rationally, which is sustainable and which creates a returns, and then, helps you create internal capital to keep growing that business for a very, very long term. So investments will go in every area of healthcare. If you take diagnostics, investments will keep going into basic diagnostics, your routine testing. I think still bulk of the business, still very profitable, still a big unmet need. We can keep debating whether unorganized and organized was created by investors or consultants like Sudhakar, Anand. So maybe I'll probably pass on a bit of that blame to the consultants. But investment will go in those areas. Again, there are now VC funds, VC investors who are also investing in innovation. If you stick to diagnostics, right, there's a lot of investment going into AI for radiology, AI for pathology, specialized testing. Again, that's a topic which can probably need one full conference itself to debate whether how fast can it grow, where can it grow. But you see that adoption happening at a very good pace. Smart entrepreneurs, good companies doing a lot of work behind it. So if I cut the long story short, investment will happen in uh, you know brick and mortar, old economy businesses, if I call them that, and also newer ideas. Just because the availability of talent, clinical talent, scientific talent, tech talent in India is probably much better than many other markets that we see. We invest in other markets in Asia as well. So both areas will see a lot of investment, at least for the next few years, and still probably the need will be unmet.
No, thanks a lot, Rahul, for that perspective. And you brought a good point that businesses has to be sustainable, whether in short term, long term, you have to define the horizon. So just now coming back to another important point of collaboration, I know that we have all the industry players who have looked at this collaboration, be it with patient, be it with providers, be it with technology companies. So Anand, what are your views? How do you see this collaboration which has evolved, and what are the challenges you also met through the journey, and how did you kind of overcome that? Because I know it's not easy always to navigate the paths once you are kind of growing the company and trying to bring a lot of partners together.
Sudhakar, as we all know, healthcare has always been all about collaboration. So it's healthcare providers. We all know about who's the payer, who's the patient, what's the product, and all that. So there's a lot of collaboration that's involved between whether different types of healthcare providers, and we, as part of the value chain, as diagnostic players, we are a very critical element, and we need to collaborate with the healthcare providers, be it hospitals, other laboratories, government organizations, government hospitals, government healthcare infrastructure, insurance companies, corporate houses. So all these different gamuts of healthcare, we need to collaborate in order to provide the real healthcare delivery. So what is important is, what is the outcome that we are looking at? So how do we influence the patient outcome, and what is the value that we create out of the whole effort? So if that gets to be recognized in the collaboration, that's the better collaboration than, when you talk about more of a transactional kind of relationship between the collaborators. So where you talk about, what is the price per test, or where you say, it's very commoditized kind of an approach. So where you say, okay, I'm going to take some services from you, so I'm going to pay you so much per test. So rather than that, if we are able to actually work on a collaboration which values the contribution in terms of how we influence the patient outcomes, so that will have a much better way in which we influence the overall healthcare ecosystem in the country. And that is how we will be much more prepared when we enter into much more mature segments of healthcare, like when insurance and such things happen in the country in a bigger way.
No, definitely. Thanks a lot, Anand, for that view, because we heard this throughout the sessions that it's patient outcomes, patient experience, rather than the transactional relationship in these collaborations. And Dr. Nilesh, what's your take? Any challenges you came or any experiences you want to share in this journey, long journey with Metropolis, which you want to highlight and which kind of made you think that is it the right industry and how did you kind of overcame that?
Uh, During these 38 years, yes, occasion it came where people didn't appreciate after a good work. And at times when you are not in front, see, the issue is that you are not always on the forefront to handle patient or to handle your partner. I'm going to call all collaborators as partner. You're not there in front and you never got chance and you depend on your team, which is 3 level down the line, who could not deliver as per the norm set. That is the biggest challenge which we face. So making your service and standard uniform across your all labs is not easy task at all. Running the lab under your nose is difficult, but running the lab remotely at multiple locations is even more difficult. There are ways, there are methods where you can bring stability to some level, which are linked to technology, using of the right your policies and procedures, and doing audits, and having a quality department, having monitoring done, audits done. All those things happen, but every challenge is very different. It is not uniform. And at times you are not appreciated for a thing which is perceived mistake or perceived shortcoming. And that is where we feel that, in service industry, at times you feel you are doing a bit thankless job. But this will be very occasional. Overall, if you ask me, I'm very proud of being part of lab industry, part of being healthcare and making difference in somebody's life, bringing health for them. I think I feel very, very proud to be there. Yeah, thank you.
No, thanks a lot, Dr. Nilesh, because definitely your critical point is that although lab industry is roughly 3 to 4% of overall Indian healthcare industry, but the impact of it is roughly 70%. So any diagnosis you look at, any treatment pathways, all of it has to start from diagnostics. There's no other way how you can navigate. So coming to Deepak, Deepak, you brought a very critical point saying, hey, we have 2,400 people in the front line and only 9 on the back end. How did you manage that? And what was the key contributor? I'm sure the technology was, but what were the other enablers to make it successful? And any challenges you also faced during this phase you want to highlight? Because managing that operations, lean operations from the back end is a superb task, right? So anything you want to share with the audience?
Sure. I think yes. So most of it has been managed by technology, but definitely putting the team together, and specifically during COVID times, making the team go to the field. It's all required a lot of manual efforts. There is a lot of automation required in the training methods also, because you are now recruiting people in 250 cities. All cannot come in one area. So you have to digitize everything from their onboarding to their training modules to their refresher trainings. So we've been able to do it again through technology, put them into a kind of a different sort of an examination, put them into different sort of in internal degrees to probably go to the next level and next level and next level to do that. Challenges, definitely there are a lot of challenges, because the day I obviously thought of doing that, a lot of people told me that actually the delivery boy goes till the door of the house and come back. Your guy is going to go 15 minutes inside the house and come back. How would you secure everything? How would you make ensure that there is entire safety and all that structure in there? So there were a lot of challenges, and a lot of challenges were solved because we were tracking. And coming down to obviously the discussions about collaborations, I think so there are internal collaborations we talked about, there are external collaborations. I just wanted to touch base on one thing. Externally, an ecosystem is trying to collaborate. There was issues in collaboration in terms of data privacy, who will own the customer, and a lot of other stuff which is getting solved. And I think there is an openness today. Insurance company is collaborating widely. The TPAs are collaborating. Corporates are collaborating. And so there's a lot of collaboration happening. Pharma is collaborating, research companies are collaborating, government is collaborating. When I talk about internal collaborations during the COVID time, I think on the March of the first month of COVID, I tried asking that if there is a collaboration group for our labs. And I was the one who formed Path Lab Uniting Forces as a first group, and called up multiple people to join, and everybody is asking who's coming. So that lab industry started coming together during that point, and then it became a collaborative this thing. And till today, that group works, and a lot of collaboration happens over there. But I think there has to be more openness towards that sort of a collaboration amongst the labs also, because there is a lot of infrastructure lying, and there has to be more innovations out there. And specifically given spending the last 10 years and the next 10 years, I think my definition internally, and this is a personal this thing, for entire diagnostic is changing. So last decade of diagnostic for us has been automation, right? And I would say it's an ABC for diagnostic for us. It's been automation, better reach, and convenience. I think it is completely changing in this decade to AI, big data, and collaborations. So that's how we define the ABC now.
No, very contextual, and thanks a lot for giving the background, because automation was the first wave and the emerging technologies are the second wave, and we have to embrace both of them in different shapes and forms. I know, Dr. Sanjay, you have been also running your own lab for a very, very long time. Any additional perspectives you would like to add here?
So I think Deepak briefly touched upon it just now, that big data. I think data is perhaps a big opportunity for this industry to collaborate. To put it into perspective, can we get a reference range that is common across the country? Now, every lab, everybody has a different reference range. Can we bring data together through this National Digital Health Mission? And can we create a uniform reference range for every test? Can we create a similar test code? Because if you want to create a universal patient ID, healthcare ID, and if you want to have interoperability of data, if a patient from any part of the country can access and still have the same level of care. So I think back-end collaboration of anonymized data, building reference ranges, building similar test codes, that will probably bring the industry together. I think the other opportunity is how do we use this data to give back to our clinicians information that is hidden. I think COVID probably did that in a big way, of using the epidemiological data to give back and identify hotspots, identify disease trends, how COVID is evolving. At Suburban, we did this in a small way in Western India by using data from our, say, culture. The common test is a urine culture. And we culled out data and we gave it back to the clinicians that if ever you have to prescribe an antibiotic, this is the trend that is prevailing in your backyard, on which is the common antibiotic, which is resistant, which is sensitive, which is the common bacteria that is prevalent. What is the incidence of each type of infection, different age group, different gender. So that data is sitting with all of us. Now, how do you create a national repository and create this kind of disease trends, which can help in planning ahead, that what is the prediction of malaria going forward? What is the prediction of dengue going forward? Where do we need to, put more effort in screening? Where do we need to put more effort in disease control? So I think there is a lot of opportunity, according to me, in culling out and bringing together this data, which can be used in different facets. And I think data perhaps is something which is at this point of time below the surface. How do we, use data privacy laws and anonymize data, make it onto a common platform, and give it back to the patients, to the clinicians, to society in general, to policymakers, that can help evolve this outcome in a better way.
Sure, please. Yeah, please.
So on data front, I'm going to talk about some limitations and some way forward and a success story, all three in shortest possible time. So limitation all the labs face that we don't have anything beyond patient demographic, test name and the result. We don't have anything beyond. And when it is B2B, even there are more limitations. We have no clinical history, nothing. However, we have a gold mine of data. We have data for a chain labs, like it's coming from various parts of the country, various kind of population and so on, people on various treatment protocol, and we have it. But somehow in the country, this is what is lacking, where a unified central depository of information, where all the relevant requirement is together and you can take out a meaning. And I want to just share one example where I worked on extensively on the data, and data became so meaningful. Like we have a test called AMH, which is for ovarian reserve, which is connected to women fertility. And the data showed year on year, fertility of the woman is going down. In younger women, AMH levels are dropping. Now we did some more work. It was 77,000 patient data. We made a cut into urban and rural population. Then we made a cut into people living near seashore, people having different lifestyle, different age group, and different strata, like rich people versus poor people. All that we tried making it after making calls and all. It has become so meaningful. It is getting published in some time. It has become meaningful. Imagine this data is given to government. I think they can take some action on it. It can go to pharma company. I think it will be useful for them, and so on. So data can be actually commoditized, can be made use for pharma companies. But when you start with this data, I think you need much more information. So frankly, I would propose, my suggestion is you have to first think of a buyer who is going to buy my data and build data accordingly. Ensure that patient demographic alone is not captured. You even take the dietary part, you take the race, age, everything you take, then it will become meaningful. Otherwise, just talking about big data, and I'm minusing genomic side, that is not my expert area, but I'm talking about rest of the thing. If this is the way data is built, it will become much more useful.
Thanks a lot, Dr. Nilesh. So also this brings me to what are the future opportunities, right? Because in a lot of sessions, we have covered a lot of ground in terms of data integration, genomics. We have talked about smart labs, also decentralized POCT for infectious diseases, and also demand for multiomics. So just coming to Anand, how do you see the industry evolving more from these new technology perspective and the future opportunities, especially in what are the areas, let's say, you will bet on in next 5 to 7 years, 10 years?
So I think, like what Dr. Sanjay said, and also Rajiv pointed out during his talk, that there are a few areas which are going to be the clear front runners as far as the future of diagnostics is concerned. So in that, if you see as an industry, it is about like what we all talked about just now. It's about how are we going to leverage the data that we have, and how data is going to play a very key role, whether it is in terms of creating some actionable outcomes, actionable insights that can be of use to clinicians. Because obviously the role of the lab is to empower the clinician so that he can influence the patient outcome in a better way. So when you look at it that way, not only like what you said, 70% of the clinical decisions are based on lab tests. But at the same time, 70%, even 80% of the structured data in a hospital, in a healthcare ecosystem, is from the lab side. So that means that there's a lot of data which is available. Like what Dr. Nilesh said, it is just currently there's just a patient demographics attached to it. If you are able to add a lot of things more to it, like clinical history, and I think with the advent of systems like ABDM, Ayushman Bharat Digital Mission, like what Dr. Sanjay was referring to, the ABA numbers, and the kind of interoperability that we are talking about between various healthcare providers and the laboratories and diagnostic centers. So you will be able to access a lot of information about one patient from different sources, which will bring together a lot of information, a lot of data, which can be further used to, really look at what can be brought out from that kind of a data. So using AI, ML, and a lot of artificial intelligence related tools, we can look at how the data can be used. So data and AI is going to be very important. I think the second one, as we again was referred to you by you as well, the omics story, genomics, personalized medicine, for which precision diagnostics is very critical and integral part of personalized medicine. So even in the previous panel, there was a lot of talk about personalized medicine. So I think that's also a very important factor where currently we contribute this genomics as such overall contributes to only about 2% of our overall industry. But I think the growth on that segment is much faster than other segments. So then you, apart from that, if you talk about the India as a story, so what we see here is even today, almost 60 to 65% of the overall diagnostic industry is concentrated in the urban areas. So we have a huge story where about 60 to 70% of our population lives in rural areas. So the tier 2 and tier 3 cities, that is going to be the next big story when it comes to how we move into these cities and how we are able to provide the healthcare facilities and how do we integrate them into the overall mainstream of healthcare services. So that is going to be a big opportunity as far as India is specifically concerned. Another aspect is what already was talked about is about preventive health. So preventive health currently contributes to 10 to 15% of the overall business in diagnostics as of today. But we see a big movement on growth on that particular segment as well because of the kind of awareness that's being created in the post-pandemic scenario. So I think these are some of the key elements where we see a sort of a growth in this industry.
No, thanks a lot, Anand. And data is just a data unless you make meaningful use of it and bring some insights. And another key aspect, what you talked about, is access to care and preventive health, precision medicine. These are all very important and relevant topic. One very quick reflection also, Rahul, from you. I know that you have different investment strategies, but anything from the future technology perspective, you would like to see more investments flowing in, especially in the diagnostic space? Do you think more on the POCT side, AI in molecular testing, multiomics, next-gen sequencing? So what do you think, what's going on and what will kind of shape up more? Any quick reflection on that? And I know we are kind of last 4 minutes, so maybe.
Sure. No, I'll try to keep it quick. See, investors will always follow where operators are going, and that's how it should be, right? Investors can't define the trend, and operators follow. That's the cart before the horse. See, all these areas, and I think some of these will grow faster, some of these will grow slower, right? But one reflection, what Dr. Nilesh also said, and I think to the debate earlier, see, there is of course a case for use of data, right? But in healthcare, things change at their own pace, right? You can crunch data, you can come out with the outcomes, but how soon and how widely it will get adopted and start impacted decision making and outcomes, that's generally a slow process, right? So that has to be, I'm speaking from an investor's perspective, right? So I'm not saying that should not be done. But again, going back to the previous point, you'll have to find the right set of investors who have that patient capital for that slow process of change to take place and happen, right? So if you see recently in the past 5 years, a lot of VC investment, this is a topic more ripe for VC investors probably. In the last 5 years, a lot of VC investments have happened into what Deepak was explaining earlier, which is in using technology to increase access, make it more convenient, and take it more B2C, right? Because healthcare has been a B2B2C subject so far, and now a lot of shift is happening to more B2C, right? Different initiatives happening to make it more B2C, where the patients who are having a much less say in decision making so far, wherever possible, wherever logical, they start taking decisions independently, and that's where many of the business models are betting, right? Now, going to, let's say, use of some deep tech in healthcare, AI certainly will grow, right? We are seeing, in fact, our VC fund HealthCode has backed an AI radiology company called Cure.ai, right? Uh, Many such other models, THB, which is a data mining company focused on diagnostics, pharma, trying to do what Dr. Nilesh was saying. Uh, AI in mental health, right? I mean, it's not a diagnostics topic, but probably linked to diagnostics in some manner. But where you, from an investor's perspective, where you see them creating revenue generating and profit generating models, some of these are still dependent on Western customers, right? In India, again, India is a very unique market. We want quality, we want innovation, but vast majority of the market doesn't want to pay for it, right? And that is where the adoption of some of these new age initiatives is slow. You will find entrepreneurs with very smart ideas. You will always find some initial takers for those ideas, but can that be taken from 10 to 20, 0 to 10 is easy. And not, I mean, not very easy, but 0 to 10 can be achieved because you'll find some takers for something new. But will that go from 10 to 30 and 30 to 50? That's where, as an investor, we get focused. But there is definitely a case for investment in innovative ideas in deep tech for healthcare. And there are pools of capital emerging which will keep supporting this. And this is bound to happen, right? Because as I said, India is a unique market which will keep fighting to fulfill basic needs for more and more, but will also keep elevating and keep moving up the value chain, right? That's our entrepreneurial talent.
No, very valid points, Rahul. I know we are coming to the end, but maybe I just want to give other panelists also an opportunity, at least for 30 seconds each. So, Deepak, what's your view? You already touched upon big data, AI, which will be the future in diagnostics. Any quick last-minute reflections you want to share with the group?
Yeah, I think like we talked about structuring of a data, it is happening. We've been actually last 4-5 years structuring the data. We don't have just the clinical data, but we have a lifestyle data. We have genomics data. We also have wearable data coming from the phones. We also have a lot of input data that we take during the collections about the entire, the weight, the height, the BMI, the BP, and all other stuff coming together, and it's becoming useful. So I think that's where the future is lying in, wherein diagnostic companies has to think beyond just giving the report, and those report will become a kind of a source for a lot of things. So we have to empower doctors. That is also our responsibility. Empowering patient is also our responsibility. I think more work to be done there.
Thanks a lot, Deepak. Dr. Nilesh, any last thoughts from your side?
On what subject?
On the data in the future, you already mentioned on the data side. Anything else you see trending in near future?
Yeah, so as I said, data has to be actionable, and labs have to start taking much more information, at least from B2C, much more information than what they are capturing. And that comes to data on lifestyle also, whether they are vegetarian, non-vegetarian, right from there. I think all these cuts will be very, very useful to take out a meaning out of it. Thank you.
Thanks a lot. And Dr. Arora, any last thoughts from your
Yeah,
side?
so I think three areas that I think clearly, there's an opportunity for us to focus on. One is, I think briefly touched upon, is mental health. And I think that's again, a tip below the iceberg. So, we can only see the tip, we can't see what's below the surface. It's just waiting to explode, literally, and it's all there. I think linked to mental health is also the aging population that we will have. This whole area around elder care and geriatric care, I think that's another big opportunity that is there. And third, I think, is how can we leverage everything that we have spoken to pick things early detection, whether it is any disease, like lifestyle disease, oncology, especially cancer. So what can we do to pick up cancer at a very early stage? Because, they say that the best, treatment for cancer is prevention. The next is early detection. So I think early detection is clearly an opportunity. So mental health, geriatric elder care, and early detection, I think, are clear opportunities for us to work on.
Thanks a lot, everyone. This was very insightful and meaningful discussion. I hope everyone benefited from it. So with that, I will kind of close the panel, and thank you, everyone, for coming here and spending time. Thanks to VOH for giving us this opportunity to come together. And over to you for other things.
Thank you, panelists, for such an insightful discussion. Thank you, Mr. Sudhakar, for wonderfully leading the discussion. Now, I request all panelists to step forward for felicitation. And I request Mr. Sudhakar to felicitate his co-panelists. Oh, yes. Yeah, sure, sir.
Maybe we can take one question. We are already time's up, but please.
So thank you. I am Dr. Dinkar Desai, President of Association of Practicing Pathologists and the Pathologist Association, and I represent the practicing pathologists as a whole. Here there are people and representative of sort of corporate laboratories. My question is, we are facing lot of illegal laboratories, unauthorized laboratories, and bogus laboratories practicing all over India in a rampant fashion. We are not talking about that. The alone fighter against this is practicing pathologists. I find such big stalwarts here who have got very much capacity to join us in this campaign openly. And as Dr. Sanjay said, we must have got a absolute register. Who are the official laboratories? What is the number? So that is most important. And may I get some answer from all three or four of the panelists, one by one? Are you planning in the nearest future to join us openly? Why not? When you can say, when somebody comes for a price war, that such and such lipid profile is at 190, 100, you also declare that. You are no more a reference laboratory. You are next door to my laboratory. So you and me are the same, on the same footing. So when I am troubled by the third laboratory, which is unofficial laboratory, fourth laboratory, which is illegal laboratory, and fifth laboratory, which is bogus laboratory, why you are not coming openly to say that third, fourth, and fifth laboratory should be banned? And unless this force comes together, and brings a lot of pressure to the government, see, there is on one side a decision of Honorable Supreme Court.
Dr. Dikta, I think it's a great topic, but perhaps maybe beyond the scope of the current discussion, maybe we can discuss it offline. And I think there's another panel discussion waiting to happen.
Sanjay, I just wanted to give a thought.
No, I think we brought it up that, how do you make accreditation, a common thread?
Accreditation is different.
No, I think that's one way. I think we can discuss this offline, I think, Thank you.
Sure. Okay.
Now, I request all panelists to step forward for felicitation, and I request Mr. Sudhakar to felicitate his co-panelists. Dr. Sanjay Arora. Dr. Nilesh Shah. Mr. Anand K. Mr. Deepak Sahni. Mr. Rahul Agarwal. Now, I would like to invite Ms. Khushbu Sharma to the stage to felicitate Mr. Sudhakar. Mr. Sudhakar Mishra. Now, I request all panelists to gather for a photo. Can we have a huge round of applause for the panelists? Now, moving on to the final discussion of the day. By unraveling the intricacies of radiology and digital pathology, this next panel endeavors to illuminate the path ahead for these crucial diagnostic disciplines. As we stand at the intersection of technological innovation and healthcare, our last panel, Diagnosing the Future, Radiology and Digital Pathology Unveiled, promises to be a thought-provoking journey into the evolving landscape of medical diagnostics. Please allow me to welcome our panelists with a huge round of applause. I request the panelists to come on stage. Mr. Rahil Shah, Managing Director, NM Medical. Dr. Deepak Patkar, Past President, Indian Radiological and Imaging Association, Director, Medical Services, Head Department of Radiology, Nanavati Super Specialty Hospital. Dr. Arun Kumar Govindarajan, Executive Director and Radiologist, RT Scans and Labs. Dr. Meenal Chaudhary, Director, Radiodiagnosis and Intervention, Radiology and Chief Strategy, Digital Marketing and Corporate Communications, Akash Healthcare Super Specialty Hospital. Dr. Surankar Datta, AI researcher and radiologist, AIMS Delhi, Vice President, Federation, All India Medical Association. And Mr. Dheeraj Jain, Redcliffe Labs. Dr. Datta will be leading this session. Over to you, Dr. Datta.
Hi. Hello. Yeah, a warm welcome to all our panelists. And unfortunately, we were supposed to have an hour for our discussion. So I was planning to do it in 2 rounds, but we have around 30 minutes. So I wanted to introduce all our panelists, but I'll just tell you a little bit about what I do at AIMS and Harvard. So I work in generative AI currently. I have done some work in computer vision in the field of AI, along with our collaborators at IIT Delhi, Jodhpur, Madras, as well as a few international collaborators. I thank the Voice of Healthcare team for inviting me for this really interesting session with all the stalwarts of our industry. And yeah, so could you guys please just take 1 minute to introduce yourself before I go to the first round?
Good evening, everyone. I'm Rahil Shah, Managing Director of NM Medical. We're a chain of diagnostic centers in Mumbai, Pune, and Bangalore, offering the full spectrum of diagnostic testing, including lab, radiology, histopathology, molecular lab, and genomics.
I'm Dr. Deepak Patkar. I head the radiology department at Nanavati Hospital, and also I'm the Director of Medical Services there. Thank you.
I'm Dr. Arun Kumar. I'm a radiologist and Executive Director of RT Scans and Labs. We are a Chennai-based integrated diagnostic provider who do both imaging and pathology tests. And we are present in around 11 states now.
Hi, I'm Dheeraj Jain, founder of Redcliffe Labs. We national chain now. I mean, we've not yet gone so much in South, but I think covering good North, West, and Central India, largely focused on pathology, but last couple of years, we've also started doing radiology, mostly through an inorganic sort of path of acquiring other radiology center. And glad to be here in this conference.
Hi, I'm Meenal Chaudhary, and I'm Director of Radio Diagnosis at Akash Healthcare. It's a tertiary care, 300-bedded tertiary care hospital in New Delhi. And we are coming up with more of our hospitals, and I'm almost 23 years plus in this profession. Thank you.
A warm welcome to all our panelists. Can we have a round of applause for all the stellar panelists whom we have on board? So I'll jump right into it. We're discussing in this panel regarding what's the future of radiology and digital pathology. Throughout the sessions today, we discussed a lot about AI, the latest practices, consolidation, collaborations. Here, we are going to discuss how these fantastic institutes have been actually been at the cutting edge to deploy these AI algorithms in their institutes. And I'll end with what is the future, the cutting edge research is happening both in India and abroad. So I'd like to start with one of our luminaries in this field, Dr. Deepak Patkar. So, Dr. Deepak, how has Nanavati made use of technological innovations to improve your patient care? And how do you bring a competitive edge by using technology to deliver your care?
So we're working on 2 or 3 fronts very, very strongly post-COVID. Of course, we had traditionally been digital hospital, but there are 3 or 4 areas which we are working very, very strongly on. One is patient safety. 2 is improving the patient experience. 3 is improving the operational efficiency. And then how we have collaborations and strategic partnerships with a lot of universities, startups within India and outside India. In terms of patient safety, we started a lot of initiatives on stroke and oncology. In stroke, we have what is called as rapid AI, which detects strokes in 30 seconds, including the penumbra and the core. And that allows us to start therapy. The door to natal time that we talk about, we brought it down from about 1 hour to 35 minutes very consistently. Last year, using this app, we thrombolized about 160 patients. This is, of course, one of the app, but also adding certain manual parameters like creating a code white. You can reduce the number of connectivities that you have to make. So one call goes to 30 people in one shot and everybody gets ready. So that is from the patient care point of view. From patient safety point of view, there are startups which are helping us having embedded systems within the bed, patient bed, which talks about any variability that happens, any kind of changes that happen when the worst time of ICU is, for example, in the night, when people are off guard. These startups are really helping us making efficiencies better, allowing errors not to happen. So that is on one side. Other side is how you improve operational efficiency. So 2 areas which we worked on very, very strongly is admission process. Now, every admission in our hospital happens bedside. Now, for that to happen, we require a lot of technological support to avoid any errors. In discharge process, there are about 9 processes which we completely digitized that reduced our TAT by about 50%. So average TAT for the discharge is about 4 hours for TPS. We brought it down to 2, and that is probably the best in the country. This happens only because of the technological advantages that have been given. In terms of collaborations, we are working on several collaborations in Parkinson, in oncology, early detection of cancers, following up those patients, giving them personalized care, etc., by providing international collaborations, local startups to reduce the turnaround time and also improving the patient care.
Thank you. So my next question will be to Rahil Shah. So can you share your insights into the current state of digital pathology in the country, and how many labs or practices are actually actively leveraging technology to assist in, let's say, pathological diagnosis?
So let's take a step back and understand the value that digital pathology can add to the field of histopathology in India. We learned from our radiology background that the one area of pathology where there is a lot of inter-observer variability, subjectivity, is histopathology. And just like in radiology, where we've moved on from a generalist reporting everything from head to toe, we moved to a model where an MSK scan, for example, a knee joint scan is seen by an MSK radiologist. A cardiac scan is seen by a cardiac imaging radiologist. We thought, why should, in histopathology, why should there not be a similar model? Today, across the country, in most histopathology labs, you will have a general pathologist who reports everything from head to toe, even though that pathologist knows that he or she cannot do justice to everything that they're seeing. But market compulsions in the way of practice force them to function in that manner. It's not uncommon for clinicians and patients, once they get a histopathology report, to ask for a second or even a third opinion at times before they finally decide how to proceed with the treatment for that particular case. And this is also the case at all large hospitals across the country. So clearly what that demonstrates is, given the extent of the inter-observer variability, differences in the diagnosis made, some of these are life-saving, diagnosis, and the histopathology report is the most important element in deciding how to treat the patient. We thought, why not bring in an element of subspecialty expertise similar to what we're doing in radiology? And clearly, the only way to drive that was through digital pathology. Once you have a digital scanner in your lab, you can digitize slides. If they're prepared in the right way and stained well, they're amenable to digitization and can be distributed subspecialty-wise. So a renal biopsy case today that comes to us goes to a renal pathologist. A breast biopsy case or a surgical case that comes goes to a dedicated breast pathologist. What that means is you get a significant improvement in the quality of reports being generated. And your access is the world. The world is at your feet. We have pathologists on our panel who are based in Bombay, some of whom are based across the country, including in institutes like NIMHANS, and many who are in the US, providing international second opinions. So the reason I'm giving this background is to show the power of the technology, which is not really well understood in our country today. And unfortunately, given the cost of adopting this technology and the amount of time it takes in terms of user adoption and change of behavior from what they're used to all these years, the rate of adoption of digital pathology in India has been abysmally low. We all heard the statistics of the number of labs operating in our country on the previous panel. Can you imagine that only about 100 labs have digital pathology scanners today across the country? Of these 100 labs, only 20 or 25 are using high-value multinational enterprise scanners. The rest of them are using single slide or local scanners that are still not validated or FDA approved. And even among the 20-25 who are using the high-quality scanners, an even smaller percentage are actually utilizing them day-to-day in their workflow. I have been to labs of large hospitals and institutes where the digital pathology scanner is just lying in one corner gathering dust. So unfortunately, today adoption is low. The market doesn't value the power of the technology. And the one innovation actually that we have seen happening locally is not so much on the hardware side, but a bunch of startups are working on creating vendor-neutral viewing platforms. Just like in radiology, we have PACS software for archiving and sharing of images. In histopathology, in digital pathology, we have startups in India investing in creating vendor-neutral viewers and image sharing platforms for both histopathology and cytology. So I think there's a lot of exciting development we're going to see on that front. But on the hardware adoption side, I don't see things changing anytime soon.
Thank you, Rahil. So both NM Medical and Nanavati are very well-known names in Maharashtra, especially. Let me go next to Mr. Dheeraj from Redcliffe Labs. So Dheeraj, how does Redcliffe Labs incorporate technological advancements in the day-to-day lab diagnosis and pathology in your setups throughout the country?
Sure. I think one of the things we have very recently done is, and again, I have to mention Abbott here because they've helped us. And we've been thinking about, what can we do clinically very different to empower the clinician to make a decision, more smarter decision. And is there any way to bring AI? And obviously, as a diagnostic chain, your own ability to bring these innovation, first to build these innovation, invest, and then implement standard throughout the country is quite hard. It's a longer journey. So we decided, let's pick up some of the best in the world. And Abbott, and I'm not promoting Abbott, but we worked with Abbott for very long on, because we were very committed to do something which is called a CDS, a clinical decision support system. And what it does is it have a data point of diagnostic reports without actually obviously naming the patient, but having the characteristics of that of the patient with its vital. And when you actually generate your report, it actually compares to all of these data points. And these are not just India specific, but these are global. And they would look someone with same age, same gender, even the lifestyle data, and can actually tell, can actually predict a kind of a possibility of a disease very, very early on. And this is very relevant for preventive diagnostic, preventive wellness. So we did this CDS. It took us 2 years to implement. And today this gives clinician, so much insight, and actually a report which normally patients would only see their vitals and they see in the range, but today they can actually see a lot more. And we piloted this, 6 months back. It's out for selected 200 clinicians. We have actually rolled out in 4 cities, but I think we yet to sort of go out national on this. But this is a very game changer, as we think, because we think nobody else have come anything similar to what we have done in the CDS. I think other thing on the technology is, as we go to home also to collect sample, 40% of our business is from collecting sample from home. So nearly 4,000 to 5,000 collections happen every day. And as Deepak at Healthian was saying, that when your phlebotomist enter home for 40 minutes, he need to have on its tab, he need to have access of various things, to deliver the good experience, but to capture a lot of different things, actually, to upsell, cross-sell, not in a way of commercially, but to actually make them aware of lots of different things, but also have to bring the sample on time. Sample have to be processed quickly. And now the time is gone where you need to give report. You could ever give the report in next day. It's a 2-3 hour phenomenon. So I think, how do you bring that whole supply chain to actually not only give the experience to the consumer, but also to bring the efficiency in logistic back to the lab? We've also been using software for quality. So we use Unity from Biorad, and all our 85 labs are actually on Biorad. So, I mean, technology which you build in-house, technology which you partner with someone like Abbott, technology like Biorad from Unity. I mean, all of these are examples of, if you want to bring, if you're sincere to bring changes and to bring efficiency, you need to partner to lots of different guys. And I think, and we've been very grateful, because some of these vendors would not open up. I mean, like someone like Abbott would not open up. I mean, they would have choices not to do this at all at first place. So, but yeah, I mean, I think this is kind of a start of seeing new kind of things happening, both at the consumer end, but also at the lab end, and definitely at the clinician end, because I think clinicians definitely need to bring a lot more smartness to the report. And I think this revolution of smart reports, we have done it, we've seen a lot of other counterparts in the industry are doing. I think that's what the consumer needs. Consumer want to see history, he want to see very precise, specific challenges, he need to see predictions, and all of that, if you can capture this nicely, that would be a kind of a great start to really implement this digital thing into the lab and to the consumer and to the clinicians.
Thank you, Dheeraj. So Dheeraj spoke of smart reports, and I think in radiology, smart reporting was brought. One of the first people to bring was Aarti Scans. So Dr. Arun Kumar Govindrajan, my question to you goes next. Can you enlighten us with the recent technical advancements in radiology, which has been implemented already in India, and your experience of working with our startups, both in India and abroad? And what does the ROI, the return of investment for such integration, look like?
Thank you, Shurankar. So as Mr. Dheeraj said, we are a service provider. We are not in a position to develop AI as it is. So we collaborated with multiple vendors. So far, we use close to 7 AI tools in our radiology day-to-day practice, and I think 5 of them are from India. One of them is Siemens, which basically is from the development hub in Bangalore. So all 6 of them are from India. So as far as ROI is concerned, to be frank, there is no returns as such in radiology AI as of now. We've been doing this for the last 2-3 years now. There are not many returns. But as Mr. Shah said in the last panel discussion, ROI is not only about commercial returns, it's more about productivity gains and improvement in quality, which we've seen done enormously by AI. And I believe that radiology AI is a disruption / problem which can be solved creatively and profitably. So,
All right. The 7th one, is it Analyze? The 7th AI product which you are using?
no, we use for chest X-rays, it's Cure. Analyze, we just signed on, so we still have not started using.
Okay, cool. Okay, so my next question goes to Dr. Meenal Chaudhary from Akash Services. So you are yourself an interventional radiologist, right? Yeah. Okay. So exploring integrated diagnostics, how important do you think it is to integrate all the radiology and digital pathology in healthcare? And what are the major difficulties which you have faced to do this from a management perspective?
So, integrated diagnostics, the word actually takes me back 2 decades. So, when I was doing my PG, we used to have this 8 a.m. meeting, which we used to call as CRPC, Clinico Radiologic Pathologic Committee or Meet. Okay, so there what used to happen is we as PGs used to present, and finally, at the end of most of the meetings, either the surgical oncologist or surgeon or medical oncologist, they used to have one comment कि यार integrate करके बताया करो ना. मतलब tell us the diagnosis integrated with all of you, all the diagnostic arsenal together. So as PGs, we used to make fun कि ये तो आपका काम है, you do, हमने तो लिख दिया, correlate clinically and by lab. So, but now, even after 2 decades later, when we do our tumor boards, we still do our CRPCs. At the end of quite a few meetings, again, the surgical oncologist and the surgeons, they say, yaar, integrate karke bataya karo na. So, even after 5 generations of EMR, 5 generations of CT, lab 2.00 or maybe 24.00, I don't know, clinical decision support system coming up in silos, we still have the burning question in front of the clinician, integrate karke bataya karo na. So for this question, when I used to think, and after every tumor board, when we kind of introspect, what can we do? It is a very good thing to integrate the data and present the diagnosis on a platter to the clinician and suggest what they can do about it. But the volume of patients we have, who has the time to look at so many things for all the patients? So I was very wonderfully, blissfully happy when I came to know about this integrated diagnostics, where this, there is this big boss sitting behind behind the stage, collecting real-time data from all the diagnostic, departments, correlating it with EMR, not like the whole EMR, but whatever is relevant to that context, taking the help of clinical decision support system and, presenting it on a platter on real time and communicating it with physician, lab guy, genomics, multiomics, patient and everybody. Like, how cool is it, So I think that integrated diagnostic is way to be. way to work, or as one of the speakers says, is wow, it's actually wow. But as you said that there are challenges in integrated diagnostics. There has to be a person who's leading it. Now, who will be that person? The diagnostician? Will it be a radiology guy? Will it be a lab guy? Will the clinician listen to a radiology guy putting in the algorithms? So, and of course, as we know in AI, it is the human being behind the AI who introduces biases in the system. So if we have biases at the input level, we'll have multitude of biases at the output level. So that is again a challenge. I mean, shall we listen to integrated diagnostic? Is it like thinking good enough for the patient? Again, legal. Who's responsible? Vendor, clinician, the radiologist, the lab guy? Who's responsible? Because it's like a whole cocktail of people who are producing that clinical pathway. So these are the things again. Then, but I think if we have some kind of standardizations happening at the input level, some regulations chipping in, some of our forums really taking up seriously, I think integrated diagnostics is the way to be. It will decrease mistakes. It will decrease delays. It will decrease. I mean, it's actually utopia if you come to think of it. So yeah, this is what I think. And add to it computational analysis, big data analysis, predictive analysis. I mean, it's just all things sweet, I think. Thank you.
Thank you, Dr. Meenal. I think with big data, AI, and more collaborations coming in between laboratory sciences as well as radiology, integrated diagnostics is going to be the future of how we diagnose patients. So we have around 10 minutes left. So maybe maximum of 2 minutes for each answer for the second round. So I'll come back to Dr. Deepak Patkar. So how are hospitals looking at the next generation of tech innovations to be at the vanguard of their sustainability campaigns?
It's a very, very big question. I'll try to make the answer very short. So we are investing very, very heavily in digital pathology, radiology, but a lot of digitization at every point. So whether it is taking appointments, giving appointments, whether it is giving discharge summaries, a lot of money is getting invested to minimize the time and optimizing the whole thing. Getting patient stickiness is another focus area for us, because once one patient comes, we have to make sure that the whole family becomes yours. In today's area today's days where people are not where your attrition is very, very high. We have attrition of nurses about 35% per year, and then doctors about 15%. So creating that individual stickiness is very, very difficult. We are using digital way to follow that. Besides looking at green energy, everybody talks about green energy, green OT, everything green, going filmless is the way forward. One, it will cut the cost. Two, it is environmental friendly. Three, you have everything at the fingertip. So we are investing very heavily on patient app. So once the patient comes to us, everything that is done at our place plus done outside can be integrated into it. We have a lot of onco patients who need to come back for follow-up. 20% of them are from either out of station, up country, or international. So getting them stickiness to us using follow-up on video calls, etc. So our video consultations, which used to be about 2 to 3% pre-COVID, have now become almost 30%. So that creates a big stickiness, and also it gives that feeling to the patient of it being our hospital. In terms of radiology, we have invested heavily, as I said, on rapid AI. There are 7 or 8 other apps that we're working on: Parkinson, dementia, cardiac AI. That will again bring down the cost to reduce the TAT for the patient and also increase the productivity of radiologists. We know world across, we're talking about radiology getting outdated versus radiology efficiency going up with AI. You're probably the better person to decide what. But what is said is efficiency of radiologists will go up by about 4 times, to 100 times by adding these apps. And we are again investing very, very heavily on each subpart of this.
All right. Thank you. So, Rahil, what are the key challenges which you feel prevent the widespread adoption of digital pathology and advancements like AI? Because this has been there for quite some time. Have we been able to establish the ROI yet, if we consider the investment which we are putting in and leaving aside the productivity gains, which you mentioned?
Yeah, I mean, that's the million-dollar question, and probably why we are where we are in the country today with poor adoption of digital pathology. There are 3 or 4 barriers, I think, that prevent more widespread adoption. One clearly is cost. It's a little bit of a chicken and egg story, right? Until adoption increases, it's hard for these multinational vendors to go back to their principles and push for a lower cost. But until that happens, labs don't want to invest, in a multi-crore digital pathology scanner. The ROI, from a cost standpoint, in our view, certainly can be established if you look at what it can do in terms of creating the subspecialty reporting engine, providing an archival service, for large institutes, where for them to get glass slides physically for follow-up cases and research and academics is almost impossible on an ongoing basis. So there's great value to be added there. And the ROI will increase when AI comes into digital pathology in a larger way. Today, it's kind of a little bit like radiology, on the surface, interesting, you play around with it, but hard to really get your sort of teeth sunk into it. The algorithms are expensive. They do only part of the work. They don't do all of it. And in India, they're not widely available. They're also tied to the vendor platform you're using. So a little more democratization of the platform, democratization of AI, will in this space will allow more adoption to take place. The other couple of restricting factors quickly are, certainly the stalwart pathologists, if you see in the histopathology space, are all, have been practicing for a number of years, couple of decades, generally, if you look at the big names in the country. And for them to, now move from looking under the microscope to moving to a digital platform is a significant change of, way of working. So there's some resistance and I think a little bit of mental block on making that adoption at this point in their career. And until they do it, the younger guys won't follow. Similarly, at a policy level, right? You don't hear much about digital pathology. I mean, it's very difficult. We are a 100% digital pathology lab. It's very difficult to get NABL accreditation for a histopathology lab because NABL doesn't have any provision for digital pathology. You don't see, I spoke about 100, 120 labs using scanners. Barely any of them are in large academic institutes in the country. So until that happens, the pathologists who are getting trained there don't really get exposed to the technology. So, a little bit of push at a regulation and accreditation level will also help in more adoption.
Thank you, Rahil. This takes me back to Dheeraj. So you're a national level player in the market right now. So does being a national player, having an umbrella of labs under you, help you a little bit more in bringing these technological innovations, considering the like economies of scale coming into play?
Our country is so huge and our country have so much challenges. I was just telling somebody the other day, we were talking in the US and they were discussing about diabetic and then the discussion moved to reproductive health. And I said, do you know India produces nearly 27 million babies every year, all part of the India. So we have 100 million diabetic patients. We got 20% of the patients in India who have NCD and hypertension don't even know the source of what is really the source, what is troubling them. We have huge number of cardiovascular. Then if we look to genomics, oncology, I think we are in our state of NCD at least is really, really bad. So if you're national chain, you obviously have access to clinicians at all level. I mean, you would have access to obviously the KOLs, but then you also have GPs who are every day looking at some of these patients and helping them, giving them tool for preventive healthcare through whatever way you could, but then helping them also on the reactive sort of on the illness-based healthcare. I mean, that is why we are here for. So, building economies, we started with one small lab and we never sort of imagined we're going to ever get into routine, but we realized there's no way you can do diagnostic in India, a comprehensive diagnostic, unless you have routine labs. And then we got one routine. We got 22 in UP itself right now in Uttar Pradesh. And there we also think it's just a start. There are 80 districts in Uttar Pradesh, 72 districts, sorry, and we think at least 70 of them should have a lab. So I think our mandate to build up a national lab chain is very, very clear. We got 85 labs. We're putting another cohort of another 85. And for us, access and affordability, somebody mentioned in the panel post-lunch, I think that is the core. And when you have that mandate to build up a national chain, and that's why I try to make an introduction. We're not yet in the South, but that's where we're sort of exploring more and more. But with that kind of mandate and that kind of platform, I think your ability to kind of roll out anything is much easier, because we're very modern, we're very new. You know, our first routine diagnostic lab is only 3 years old. So you could imagine all of these, from Hariba, gentleman sitting here, Rajiv, you know, you have given us some of the very advanced setups. Same with Roche and Abbott and TransAsia folks who are now here, if Suresh is here. So all of the whole industry came together, you know, and got the best of the fleet to us. So for us to implement anything at the lab is very easy. Dr. Sonal from Mumbai lab is also here. She can tell how quickly she has scaled up from a 200 sample a day to 1,000 sample a day in one lab. So and therefore, you know, you also bring standardization much easier, because you know that you have to get everything same across all your labs. And then clearly, from a commercial perspective also, you know, it is much easier, because then you can negotiate to vendors like him when you are trying to do something in bulk in a very different way, comparing to when you have, you know, few centers. But, you know, both it's a privilege, but it's largely an opportunity to set up something, you know, as national as possible in the current times where technology is clearly helping across all the domains.
Thank you. I think they've switched on the lights. We'll be quick. So post implementation of these AI algorithms in practice, this question is for Dr. Arun Kumar. How do you monitor the performance of such models? And how do you account for the, as you know, there are data shifts which happen once you implement AI algorithm. And how do you account for the bias which it is creating for your radiologists?
So yeah, I classify this pre-implementation and post-implementation. Pre-implementation steps for us is very easy. So we just validate the AI algorithm, try to see whether it generalizes to our particular set of machines which we use, the particular set of protocols which we use. So basically we have only 3 sets of scanners across our 65 scan MRI fleet. So it's easy to see the generalization. So pre-implementation for us is easy, the validation part. But post-implementation, it gets a lot trickier, because we have to monitor the 6 or 7 AI algorithms every month or so, see for a shift in data. And what we did was every month or so, we had a random sample, real world sample picked from all these data sets and evaluated them manually, which was very difficult to scale and was tiresome after a while. But at present, we found a solution to it. What we do presently is we give a button to every radiologist. When he is doing a reporting, it's a mandatory button. So any study, any DICOM study, radiology study, which comes with the AI report attached to it, the radiologist has to validate it then and there, the study plus the result, and then he has to accept or discard the result. If there is discordance between the radiologist and the AI output, he discards. So at the end of every month, we take the discards into account and classify them as false positives and false negatives, and the business became easier.
Thank you. My final question to our panelist, Dr. Meenal. How do you envision the transformation of this diagnostic practice and industry, as you would say, in the next 5 years? And where do you see your own institute, Akash, being a major player and playing a key role in this transformation?
So you told me time's up and you've asked me such a big question. See, diagnostics, we've been hearing since morning, diagnostics have a big role to play. And from a backstage artist, we are now the center stage artist, and we will, with the coming up of more of AI and integrated diagnostics, we will be like a team to the clinicians, guiding them even to how to treat the patients as well. So diagnostics is undergoing a revolution. Radiology and lab, they have been, after every 5 years, we feel that we are 50 years into the radiologists, looking at the changes what have occurred in this industry. So yeah, diagnostics are here to stay. People have to, accept artificial intelligence as their key partner, and they have to be the drivers of artificial intelligence rather than fearing artificial intelligence. And I think there's no looking back for diagnostics. As far as we are concerned, see, change is always difficult in healthcare industry, but we have done major groundwork for integrated diagnostics to be there in our institute. We are almost 95% on EMR. We are using clinical decision support. Even our OTs and ICUs are on EMR. Leaving aside few percentage of patients in ER, we are 100%, almost 98% on EMR. Fully sustainable radiology department, unless it is a patient's dire wish to get the radiology films, we don't promote films. And we are looking forward to changing our pathology into digital pathology soon with collaborations. So the groundwork is ready. We are collaborating with AI partners. And I think times are exciting. Next 5 years or maybe next 2 years, diagnostics will be game changer in this industry. Thank you so much.
Thank you. So our time's up. I'll just quickly summarize the key points which we can take away from the panel. Is that ultimately these new age technical advancements are going to improve our patient experiences and the patient care. AI is there and it's going to transform the way we are currently diagnosing our patients. The major return on investment would be the productivity gains which these technologies are bringing to us in the initial part. And as we go further down the line, we see bigger adoption. I think the ROI will be established for most of the tools. Integrated diagnostics, wherein we consider all multimodal data, is the way forward, and we look towards more and more collaborations, not only between practices and these new startup industries, but also among practices, so that we can leverage the bargaining power as well as the power of big data, a huge amount of data, to develop smarter and better tools. And finally, yes, we will need to keep auditing our AI tools once we are putting them in practice, because all throughout the world, we have seen that data shifts are a huge reason why many of those tools start showing decreasing value and decreasing accuracy with time. So we need to be aware of the data shifts which are happening, as well as the biases which are getting created once we are deploying the AI tools. So just before closing the panel, I'll just tell you, there are a lot of youngsters out there who might be getting into the field maybe 2 to 3 years down the line. So all across the world, the current cutting edge research which is going on in this field is essentially integration of different diagnostic modalities, which we call as multimodal data. We talked about the huge cost of development of AI tools. That is being significantly decreased by developing models like foundational models. So just like you use ChatGPT and then you use your own custom GPTs for very specialized tasks, there are foundational models being created by Stanford and Harvard, which will require very few samples from our own center to just show them what exactly we're trying to find out, and we can deploy them. Apart from that, the third level, which I think around 5 to 10 years down the line we'll be seeing in regular practice, is the development of something known as generalist medical AI, where these AI assistants or AI tools are essentially will be at par with the kind of work which diagnosticians as radiologists or laboratory science people we do. And they will be essentially helping us in just creating the entire reports right from the scans, and we will be essentially vetting those reports and signing off by accepting those or adding our own findings. Yeah. Thank you. So a huge round of applause to our panelists, and thank you so much for taking your time and coming for this event. So back to you.
Thank you, panelists, for such an interesting and insightful discussion. Thank you, Dr. Datta, for wonderfully leading the discussion. Now, I request all panelists to step forward for felicitation. And I request Dr. Datta to felicitate his co-panelists. Mr. Rahil Shah. Dr. Deepak Patkar. Dr. Arun Kumar Govindarajan. Mr. Dheeraj Jain. Dr. Meenal Chaudhary. Now, I would like to invite Ms. Khushbu Sharma to the stage to felicitate Dr. Datta. Dr. Surankar Datta. Now, I request everyone to gather in the center of the stage for a group photo. And now, we will commence the award ceremony in a couple of minutes. I request everyone to remain seated.
Hi everyone. Good evening once again. And now we finally begin the award ceremony and officially commencing the Diagnostics Innovation and Excellence Awards 2024 by Voice of Healthcare. A part and a first of a kind initiative by Voice of Healthcare. While we were articulating the entire set of awards, we had a singular goal in mind: to celebrate the Indian diagnostics industry to the maximum. So today, we would be taking this opportunity and felicitating the veterans and leaders in the diagnostics industry, the top pathologists, radiologists, researchers in the diagnostics industry, and also the emerging leaders, the emerging researchers, and innovators, solution providers in the industry. So without any further ado, we'd like to begin the award ceremony. I'd first like to call upon the stage Dr. Naveen Nishchal and Mr. Manish Jindal to come up on the stage for the felicitations. The award categories are basically divided into two major sets: the individual and the organization categories. Beginning with the individual category, the first category for today is Emerging Radiologist of the Year National. And this award is for Dr. Meenal Chaudhary. Can we have you on the stage, please? Next up, we have Emerging Radiologist of the Year West, and this is for Dr. Mitusha Verma. Can we have Dr. Mitusha on the stage, please? The next category is Emerging Innovator in Radiology, and this award is for Dr. Arun Kumar Govindarajan. Can we have Dr. Arun on the stage, please? The next category is Pioneer in Diagnostics Quality, and this award is for Dr. Nazim A. Shahbazkar. Can we have Dr. Nazim on the stage, please? The next category is Diagnostic Innovator of the Year, and this is for Dr. Nikita Oja. Can we have Dr. Nikita on the stage, please? The next category is Emerging Pathologist of the Year North, and this is for Dr. Jatin Munjal. The next category is Emerging Pathologist of the Year West, and this award is for Dr. Rupa Jain. Dr. Rupa, can we have you on the stage? The next category is Emerging Pathologist of the Year West, and this award is for Dr. Sai Janamache Nemari. Can we have Dr. Sai on the stage? The next category is Pathology Innovator of the Year, and this award is for Dr. Srinivas Chakravarti N. Dr. Srinivas, can we have you on the stage? The next category is Young Achiever in Radiology, and this award is for Dr. Suvrankar Datta. Can we have Dr. Suvrankar on the stage? The next award is for Emerging Leader in Diagnostics, and this award is for Dr. Antara Singh. Can we have Dr. Antara? The next award is for the Diagnostic Icon of the Year, and this award is for Dr. Rajiv Gautam. The next award is for Diagnostic Leader of the Year, and this award is for Mr. Anand K. Mr. Anand, sir, can we have you on the stage? The next award is for Diagnostic Visionary of the Year, and this award is for Mr. Deepak Sahani. Can we have Mr. Deepak on the stage, please? The next award is for the Radiologist of the Year, and this is for Dr. Deepak Patkar. The next category is Pathologist of the Year, and this award is for Dr. Dinkar Desai. The next category is Diagnostic Entrepreneur of the Year, and this award is for Mr. Dheeraj Jain. And time for the Lifetime Achievements. The Lifetime Achievement in Clinical Laboratory Science, and this award is for Dr. Banwari Lal Gupta. Can we have Sankalp on the stage, please, to receive the award? The next award is for Lifetime Achievement in Diagnostics Microbiology, and this award is for Dr. Rajendra Bhanudas Surpa. The next award is for Lifetime Achievement in Histopathology, and this award is for Dr. Lalit Kumar Vinodilal Lal. Can we have Dr. Lalit Kumar, please? The next award is Lifetime Achievement in Diagnostics Quality, and this award is for Dr. Avinash Phadke. Can we have Dr. Avinash or somebody from the Agilist team to receive the award, please? The next award is Lifetime Achievement in Diagnostics Leadership, and this award is for Dr. Sushil Shah. Can we have Metropolis team to come on stage, please? And moving on to the organizations category. The first category here is Best Diagnostic Lab Chain of the Year West, and this is for Krishna Diagnostics. Can we have Team Krishna on the stage, please? The next category is Best Diagnostic Lab Chain of the Year South, and this award is for Quantum Specialty Diagnostics. The next award is Best Diagnostic Lab Chain of the Year National, and this award is for Agilus Diagnostics Limited. Can we have Team Agilus on the stage, please? The next category is Best Standalone Lab of the Year North, and this award is for City X-Ray and Scan Clinic. Can we have Dr. Akar on the stage, please? The next category is Best Standalone Lab of the Year West, and this award is for Histopia Labs. Can we have Nikita on the stage, please? The next award is Best Standalone Lab of the Year South, and this award is for Dream Diagnostics. Team Dream Diagnostics. The next category is Fastest Growing Lab Chain of the Year, and this award is for Redcliffe Labs. Can we have Dheeraj on the stage? The next category is Emerging Diagnostics Lab Chain of the Year, and this is for Unipath Specialty Laboratories. Team Unipath on the stage, please. have another winner in this category. So Emerging Diagnostics Lab Chain of the Year is also for Lupin Diagnostics Limited. Team Lupin Diagnostics on the stage, please. The next category is Innovative Diagnostic Company of the Year, and this award is for Horeba India. Can we have Dr. Gautam on the stage, please? The next category is Emerging Diagnostic Startup of the Year, and this is for NeoDX Biotech Labs Private Limited. Team NeoDX on the stage, please. The next category is Emerging Make in India Diagnostic Manufacturer of the Year, and this award is for Kriya Medical Technologies Private Limited. Team Kriya on the stage, please. The next category is Diagnostic Startup of the Year West, and this award is for LabCare Plus Diagnostics. The next category, Diagnostic Startup of the Year North, and this award is for Red Drop Diagnostics Private Limited. The next category is Best In-House Diagnostic Services in a Hospital for Northern Region, and this is for Yashoda Super Speciality Hospitals Private Limited. Team Yashoda. The next category is Best In-House Diagnostic Services in a Hospital for Western Region, and this award is for Jahangir Hospitals. Team Jahangir, please. The next category is Best In-House Diagnostic Services in a Hospital for Southern Region, and this award is for Sri Ramakrishna Hospital. The next category is Diagnostic Excellence in Radiology, and this award is for X-Ray Digital, a unit of U4RAD Technologies. Can we have Team X-Ray Digital on the stage, please? The next award is for Best Impact Initiative in Diagnostics, and this is for Saifi Hospital. Team Saifi on the stage, please. The next category is Best Diagnostics Logistics Company of the Year, and this award is for Credent Logistics. Can we have Team C3 on the stage, please? The next category is Best LIMS of the Year, and this award is for IT Dose. Can we have somebody from IT Dose team? The next category is Best Make in India Diagnostic Manufacturer of the Year, and this award is for Accurex Biomedical Private Limited. The next category is Best Precision Diagnostics of the Year, and this award is for OnQuest Laboratories Limited. Can we have Team OnQuest on the place, please? The next category is Best In-House Radiological Services in a Hospital, and this award is for Nanavati Max Super Speciality Hospital. Team Nanavati Max on the stage, please. The next category is Outstanding Contribution to Healthcare Management Education, and this award is for NMIMS. Can we have Team NMIMS? The next category is Diagnostic App of the Year, and this award is for Tata 1mg. The next category is Diagnostic Startup of the Year, and this award is for Karkinos Healthcare Private Limited. Team Karkinos on the stage, please. The next category is Diagnostic Excellence in Pathology, and this award is for CRL Diagnostics. The next category is Most Trusted Diagnostic Center of the Year West, and this award is for Platinum Diagnostics. The next category is Most Trusted Diagnostic Center of the Year South, and this award is for Andhra Healthcare. Team Andhra Healthcare on the field, please. The next category is Best Diagnostic Medical Equipment Provider, and this award is for Lawrence and Mayo. Can we have Team Lawrence and Mayo on the stage, please? Anybody from Team Lawrence and Mayo on the house? The next award is Outstanding Research in Diagnostics, and this award is for Voxter Bio Limited. Team Voxter on the stage, please. The next award category is Best Diagnostic Product Device of the Year, and this award is for Devinter Optical. Can we have Team Devinter on the stage, please? The next category is Integrated Telehealth and Digital Diagnostics, and this award is for Beto Health Arcs Technologies Private Limited. Team Beto on the stage, please. The next category is Patient-Centric Diagnostic Company of the Year, and this award is for Adarsa Private Limited, Hello Health. Can we have Team Adarsa on the stage, please? And well, here we are saving the best for the last. Our series of lifetime achievements would have been incomplete without felicitating sir. So the lifetime achievement in diagnostics affordability is for none other than Sir Mr. Suresh Wazirani. Sir, can we have you on the stage, please? And with that, we wrap the award ceremony. Many, many congratulations to all the winners. Request everybody whoever has won the award to come on the stage for a group picture. Can we have all the winners in front for the group picture, please? With your trophies, please. If you could bring your trophy, that would be great. Thank you again, everyone, for participating at the second edition of National Diagnostics Forum. We're really excited and we will look forward to your participation next year as well in the third edition. Thank you so much. With that, we wrap the sessions.